So most of the time people think that skin is only about what we see outside, right? But you would be surprised that the skin is the first marker of any disease happening inside your body. So as dermatologists, we have dedicated a year of study only to find out what are the systemic signs that some clue on the skin can afford. So many times we see that we can diagnose even things like cancer happening inside the body simply by looking at changes in the skin, hair and nails. So this is something that people don't know. So I always tell my patients, you keep a clear eye out on your skin, and if there's anything that is out of place, if you feel there are some changes in your nails, some increased hair fall, or sudden changes in pigmentation or freckles, or a simple mole which was sitting quiet for so many years, suddenly spreading, always come and ask us what it is about, because we are always available. And so we'll be able to give you some insight, little bit more as to why are these changes happening in your body. You will be surprised to know that there are so many diseases inside the body which manifest as nail changes first.
Wow.
Yeah.
Example?
So suppose you've had an infection, a bad infection, maybe 2-3 months ago. It's only 2-3 months later that the patients come to us and tell us that, doc, my nails are looking very funny. There are some lines developing in my nails, and we're talking about horizontal lines which come on the nail, right? So it means that 2-3 months ago, there was a severe infection in your body which caused your hair and nails to stop growing and all the nutrition to be diverted towards rectifying the infection or whatever that serious, maybe a serious trauma or a surgery, or even during COVID when people had severe COVID, there was a phase of complete stop of growth of hair and nails in the body. So that was that line. So your skin is actually a great marker for your body's health.
Interesting.
Yeah.
That's a nice fact. Dandruff seems to be like a very common problem. Like almost everyone I know have been through this like dandruff phase.
Yeah.
Is dandruff just dry skin flaking off, or is there something else going on? Why do some people struggle with it frequently and some others don't face dandruff at all?
I would say when it comes to hair, there's at least 80% of the patients who have some variant of dandruff. So, dandruff is not just a very basic term. So there are some diseases in the skin which also look like dandruff. Something like a sebopsoriasis, which might look only like a very stubborn dandruff, which doesn't go away with treatment. So when we're talking about dandruff, we're talking about overproduction of oil on the scalp naturally by the person. And that oil gives chance for a fungus to grow. And that fungus causes flaking of skin, and that is dandruff. So you might get it as only flaking on the scalp, which you're talking about greasy dandruff, or we might get it as an itchy rash which comes on the forehead, or white patches which come on the skin, or pimples which come on the back and chest.
So these are the
variations of dandruff. It is not only about your scalp, it is also about what happens on your body because of that dandruff. Interestingly, you said that some people struggle with dandruff all their life, which they do, because dandruff is not a one-time problem. It is a type of continuous chronic problem. So a person who's got dandruff should know what to do to get rid of it. So many times when you prescribe an anti-dandruff shampoo, patients will ask us, Doc, how long do I use it? So I always sort of ask them, how long will you brush your teeth till you have it?
Okay.
Isn't it? So that's the way.
Thing.
Yeah, exactly. So you use a good anti-dandruff shampoo to make sure that the oil that you are producing doesn't harbor a fungus.
So I want to get deeper into it.
Yeah.
So do you always trace back dandruff's cause to overproduction of oil in the skin?
Sometimes.
Or is there other reasons why dandruff occur?
Yeah, of course. So we have like mild, moderate, severe, and then there are diseases which look like dandruff.
Okay.
So when you're talking about mild, moderate, generally these are people who are doing okay, and then say there is a period of stress, or there is a deadline at their work, or there are some exams happening. So you would see the children in their 10th and 12th grade invariably develop dandruff because you're producing so much oil naturally, right?
Okay.
And they don't have time to wash their hair frequently, and that's when you get dandruff, right? So one is overproduction of oil. 2 is flaking of the skin naturally, which happens in diseases. So that is called sebopsoriasis, and that's a very deeper and more severe form of dandruff.
Help me visualize this, how you said it's caused by fungal infection.
Yes.
White part, what we see, this shedding, is the skin, right? Not the fungal colony.
Yes.
Okay, so how does fungus make an entry into skin and cause dandruff? what goes on in there?
I'll tell you about it because it's easy to explain with a diagram, right? I'm not sure if this is reflecting. So here are your hair follicles.
Okay.
And this is your sweat and oil glands. These are called sebaceous glands, which are there around the hair follicle. And these guys are constantly pumping oil onto the top part of your skin or your scalp. Now, if the oil remains, these are rich in fats.
Mm-hmm.
And there are certain type of fungi called Malassezia which love to live. It's fat loving. So they go and stay on the hair follicle and they increase the shedding of these skin cells. So instead of individually falling, it falls as a group, as a flake, along with fungal particles. So that is your flaking that you observe.
So fungus lives at the top. Doesn't go.
It doesn't get into the scalp. No, it doesn't get.
Just feeds on the oil it produces.
Exactly.
Okay.
Yeah.
Even people have dandruff on the beard. So
Yes.
like one of my friends complained
Yes.
that he's not keeping beard because it leads to dandruff problems.
Yes.
So does it always occur at the region where there is air?
Yeah, so there are some areas on the body, we call it seborrheic zones. Zones where I showed you those oil glands, right? Where they are rich. So that's the scalp. In men, it is the beard area. People have it in the armpits, axilla, and in the groin area. So it's not uncommon to find a person who's got dandruff on the scalp having itching in areas far away from the scalp. So many times when we tell patients that their groin itch is related to a fungal infection which is also there on their scalp, they're shocked. But we see it very often. And you're right, it can happen anywhere on the seborrheic areas of the body. So scalp, beard and mustache area. Sometimes you get it between your eyebrows as well.
So you mean it's a lifelong thing?
Yeah,
so
yeah,
you can't treat dandruff at one
Yes.
medicine?
Yes,
or
yes.
It's a skin maintenance issue, is it?
Exactly. It is part of your grooming. So if you know you have dandruff and you don't want it to be visible, or you like wearing dark colored clothes but you feel that the flakes are very visible on your shoulders, use a good antifungal shampoo which stops the flaking of the scalp. And that's about it. So these are all like anti-inflammatory shampoos. They reduce the inflammation on the top part of the skin.
Okay. So what do anti-dandruff shampoos do?
Many types of anti-dandruff shampoos. Yeah. So we are dealing with what? So when we are talking about dandruff,
How do people choose anti-dandruff shampoo for their condition? Like there are various spectrum of dandruff, right? So
it's a little difficult for the patient to figure it out, but we can help them through that because, like I mentioned, sometimes the scaling is only stress triggered where there's a lot of turnover of skin. Right? So that means there is some inflammation happening under the skin. For them, we use an anti-inflammatory shampoo. It doesn't have to be an antifungal shampoo. Then there are people who are harboring the fungus. So you see that greasy, you can make out when we see it. When you see that greasy dandruff, we give them an antifungal. So there are many types, right? You have ketoconazole, you have cyclopyroxamine, and then you have anti-inflammatory agents like fluocinolone. So depending on the type of dandruff, we give them. And if there are some variants, severe variants, which has got like large flakes falling. So for them, we give them even coal tar because coal tar is something which reduces scaling on the skin.
Okay.
Yeah, so coal tar shampoos, they are not pleasant to use, but they do help the problem a lot.
There are very diversity in cases, right?
Yeah, there are.
Okay.
So it's difficult for a person to figure out where they fit in, but once they meet a dermatologist and find out which side of the spectrum they are on, and they start using the shampoo and realize it helps, then they need to continue using it. So that's the message.
Okay, there's this belief that dandruff means your scalp is dirty and you're not washing enough. So is that true? Or could overwashing actually make it worse?
Yeah, so that is the most common statement which I ask my patients as well. How often do you wash your hair? So the myth there is that people feel that washing the hair more often causes hair fall, which is absolutely not true because your hair follicle is so tightly, it's there way under your skin. It's almost at the subcutaneous tissue. There's nothing on top that should be able to pluck it out. So, which means that the healthiness of your scalp is determined by how much blood flow is reaching your hair follicles and making it strong, not by how often you're washing your hair. But then coming to your question where you ask me, does it mean they're not washing their scalp enough? Yes, they are not washing their scalp enough because they're allowing the fungus to grow. It's like removing fungus by using an antifungal shampoo and then giving it a clean slate. So that is not happening in those people. So they're constantly producing oil and dandruff.
And even it's like fungus love humidity and wet regions,
yes,
right?
moisture and heat, yes.
Right.
Yeah.
So when like overwash it,
Yeah.
if they don't dry it enough,
Yeah.
would that cause,
Yeah,
would that
absolutely.
worsen the condition?
Absolutely. So if they're tying the hair tightly after washing it and that area is very moist and hot, then definitely that can trigger more dandruff production. That's true.
So then we can, is there any tricks to prevent dandruff, like, preventive measures
Yeah.
to prevent dandruff
Yeah.
from happening?
Yeah. So see, if you're a type of person who doesn't care about the length of the hair, right? So then definitely you can wash your hair, cut it a bit shorter so it's easy to maintain, and wash and dry the hair regularly. And don't wash with very hot water, because we have established that hot, moist increases fungus. So it should be a quick lukewarm rinse, right, of the scalp, preferably using an antifungal shampoo to make sure that the environment in the scalp is not suitable for a fungus to grow. So that we can do. And please don't oil the scalp. I mean, I can't say it enough. None of the dermatologists are fans of oiling the scalp, because when you oil the scalp, what actually helps is the motion of oiling, right? So you're massaging your scalp and you're improving blood supply to your hair follicles. But the oil that you're putting, you're just encouraging the fungus to grow more. So I tell patients with long hair, why don't you oil the length just before you have a bath? No oiling the scalp, and please don't sleep with oil on the head. That is the worst possible thing that you can do for dandruff.
Why?
Because you are blocking this outlet here. You're not allowing the naturally secreted oil to come out. You're helping the fungus to form a biofilm over there, right? And you're potentiating the growth of fungus.
So that is actually worse.
Oiling the hair is...
Okay.
Nothing can get worse than that.
But they say coconut oil is the antifungal one, so antifungal oil.
Really? You think so?
I don't know what dermatologists say about coconut oil.
So I'm sure I'm the villain for so many mothers and grandmothers, because when I'm telling the patient that, I get those looks, dagger looks, that we have always oiled our hair. Nothing. Yeah, maybe. But the child is now in 10th and is already producing a lot of oil due to stress. And then you're putting so much oil on top of it. So you can imagine how much they come with a lot of fungus and pimples on their forehead, pimples on the chest, pimples on the back, and you can smell the fungus of the child when they enter.
Seriously?
Yeah, so
Okay.
oiling is not always a good thing, and it's not for everyone.
So do bald people will also have dandruff?
Yeah, okay. If your follicles are visible, like see, now we're talking about, there are many types of baldness, right? There are people who shave their head because they don't want their hair to grow, but their follicles are intact. If the follicles are intact, it means your oil glands are intact. So you are producing oil, isn't it? So, and in fact, many people know they have dandruff only when they go to Tirupati or they go somewhere and offer their hair. And when they shave the head, they see these big, big patches and flakes, which they never realized was there before. So your hair is only hiding the dandruff.
Okay, does dandruff cause hair fall, or is it just another myth?
It does.
It causes hair fall.
It does go, because you think about it like a flower bed where the flowers are growing beautifully and then there are weeds in between. So those weeds are choking the growth of the flowers, isn't it? Similarly to dandruff, the soil is not healthy. So the growth of the hair gets hampered because of the fungus.
So does that mean it also, the fungus living at the top of the follicle, would they have impact on the hair follicle, or they just settle at the top?
They do settle only at the top, but because they are there, they are pro-inflammatory. They increase inflammation. So when there's more inflammation, there is less good stuff happening for the hair to grow. It's a very stressful situation for hair to grow, basically. Yeah.
So you mean they block the blood supply?
No, they don't do anything directly. But, with the medicine, it's always symbiotic. Whatever is happening in one area, which is causing a lot of inflammation, means there are a lot of WBCs and all those cells, white blood cells going there. And they're increasing that because the patient is also scratching. It's itchy. It's giving some sort of cytokines which are causing a lot of itch. So when you're constantly scratching and, picking at the scalp, then the hair growth is hampered with, for sure.
Any quick do's and don'ts for someone battling dandruff right now?
In a nutshell, I'd probably say that have a quick hair wash, if for girls with long hair, 3 times a week, for sure. And whenever you're using antifungal shampoo, they do dry out your hair, right? So use it only on your scalp. So wet your hair and massage it nicely on your scalp and leave it for the duration of your body wash. And after your body wash, you put water and rinse it out. And protect the length of the hair with a conditioner. For boys, wash your hair every day. If you have short hair, please wash it every day. There's no harm in washing it. If you have a family history of male pattern baldness, that might be the reason why you're losing hair, not because you're washing it every day. Right? You're washing it every day to reduce oil production on the scalp. So for dandruff, it is you stick to your treatment goals. When you feel that your scalp is free of dandruff, for that duration of time, use your regular shampoo, and you can switch back to your antifungal the minute you feel it's building up again.
Okay, this is a very technical one. So there are so many anti-dandruff shampoos in the market. Head and Shoulders, Nizoral, Sales and Ketomac. So what ingredient should people actually look for, and do expensive ones work better?
Expensive is not always better, isn't it? But I think the expensive shampoos have added some ingredients in them which sort of nullify the drying effect of ketoconazole. So ketoconazole is a star ingredient here.
Okay.
It is an antifungal element. So that is the one which reduces the growth of the fungus on the scalp.
Okay.
But of course, all antifungal shampoos cause dryness. So the expensive ones possibly are using materials which reduce that impact of drying of the scalp. So that's one. Then we have shampoos like Selsun has got selenium sulfide. So sulfides we know don't smell that great, right? So those are all age-old shampoos where people used to use it, but they never liked using it because of that stink. Sulfide, we are talking about rotten egg smell.
Right.
Almost.
Fart.
Yeah, sulfide. So that's about one. Then you have what else you said? Nizoral. Nizoral is ketoconazole. Simple old Head and Shoulders has got ZPTO, zinc pyrithrone, which is also an antifungal element. So for beginners, I think a simple Head and Shoulder daily hair wash should suffice.
So, and it's a lifelong thing. Like you have to keep using it.
Yeah,
Like
so do we.
dandruff it doesn't stop. Like
There's no rest for the wicked.
Okay.
You keep using it.
And how common is dandruff? Like as a dermatologist, out of 10 people, how many people would have dandruff?
At least 40%.
40%. Yeah. There is traditional remedies like that Indians have used for generations, like neem water, curd, fenugreek seeds, and tea tree oil. Do any of this actually work scientifically? All these traditional recipes?
So, neem is used for multiple, but then again, it's in an oil base, right? So, like we mentioned, oil is not a good plan. Fenugreek, I'm not very sure. I think they sort of grind it and they put it on the scalp. And so, again, there is like some added stuff which is kept for a long period of time. I do know a lot of people who use lemon, those who use curd, those who use like citric things to get rid of the dandruff. But honestly, if you have a simple antifungal shampoo, why would you go through that entire thing of dirtying your bathroom with all this?
Right.
Isn't it? So I always tell patients, don't marinate your scalp. Marinate chicken or fish with a lemon. Why would you want to use so many things and complicate it rather than just use a simple antifungal shampoo?
I think we have covered dandruff.
Yeah.
So, simple one. So, nothing to add to dandruff. This is it?
This is it.
Yeah. We'll go to the hair fall. Most, biggest problem.
Yeah.
Most people worry a lot.
Yeah.
Psychologically, emotionally, in every aspect.
Yes.
And I think everyone panics when they see air in their drain or the pillows. How much hair fall is actually normal? And when should someone start worrying?
So, see, when we tell patients that, 100 hair a day is normal, then they actually do take it very seriously, and they are mentally calculating how much hair they lost during the day. There's no need for that. So to put it very simply, if you notice hair fall in areas or in places where you've never had, like say you're simply sitting and then you're just running your hand through your hair and you're getting 10, 20 strands of hair with every time you're running, that is not natural. That is unnatural hair fall. But if you're having a bath, say once a week, a hair wash once a week, and then you're seeing a large quantity of hair falling, that's all right, because you've been losing hair throughout the day. Every day around 100 strands are being lost. And at the end of a week, you'll have around 600, 700 strands there. So panicking for once a week wash with that many strands, that's not necessary. But if you're losing hair, even in simple acts, all over the house, you're seeing long strands of hair for women. And for men, when you wake up in the morning on your pillow, if you're seeing a large number of small, tiny hair follicles which are fallen, which have not been falling before, that's the time to start worrying a bit and figuring out why is it happening. Because hair health is also related to vitamin health inside the body.
Is it different for men versus women?
Yeah, it is. So for women, we see that a large number of women are not having enough of iron in their diet. So for a girl, especially nowadays, we see that girls get their periods a lot earlier than it happened before. So maybe at the age of 9 or 10, they start having their period. So every month, they're losing amount of iron from their body, which they are not supplementing by way of diet. So it becomes a negative trend by the time they reach their 20s and 30s. If they're not actively eating food which is rich in iron, they will be in a negative iron or ferritin trend, which further leads to hair fall. So when we check the ferritin levels, we see that it is so low. It should be somewhere around 90. It will be in single digits. So it is not unnatural to get hair fall when your iron levels or iron stores in the body are very low. It might be the first sign of anemia. Then we have people who are vegetarian, right? So, and their intake of fermented food is also less. So in such people, we see their B12 levels are very less, and that causes hair fall as well. That's another reason. People with low vitamin D, that is a major cause of hair fall for many people.
Wow.
Yeah, because we are not exposed to the sun in our profession, and we are quickly getting in and out of cars and reaching our offices and sitting indoors. So if you're not supplementing yourself with vitamin D, that can lead to hair fall itself. And many a times, dermatologists are the first ones to pick up patients with thyroid problems because they first come to us with hair fall and dry skin. And then when we do their thyroid profile, we figure out that they are suffering from hypothyroidism. So those are the 4 basic tests that we do: iron, B12, D, and thyroid.
So these are the most fundamental causes of hair fall.
Yes.
Which can be fixed through diet.
100% or by medication.
How about hard water? Like people complain
all the time
coming to Bangalore because when they blame Bangalore hard water for hair fall.
Not only people coming to Bangalore, people living in Bangalore, moving from Koramangala to Whitefield or Whitefield to Hebbal. They say that we will change the location and now the hair is falling. So the deposits are there on the length of the hair, right? But your hair primarily grows, like we mentioned, from inside. So that is from almost the fat layer, where the amount of blood vessels which are there supplying the hair follicle should be supplying all the good stuff to allow the hair to grow. So whatever happens from outside, that is your hard water depositing on the length, it can cause a little bit of frizziness, maybe, but not hair fall per se. It can make hair brittle. To break, but it will not allow it to fall from the follicle. That's a different reason altogether.
Right. There's different hair fall, like hair from
the root.
From the root and hair from the strand, right?
Yeah, that is breakage, like when you do chemical treatments.
The cause of hair fall in men and women is the same, dietary related.
That is more in women. In men, we have a large population of men who have a very strong family history of male pattern baldness running in their family. This is all what my patients keep playing with. So this pattern is always there, right, in family. So it can come from mom's side or dad's side, primarily from dad's side. And if that pattern is there in the family, the right time to take treatment is in your 20s, early 20s, so that you can prevent the hair from falling. So that's what we're looking at. We're looking at a preventive measure, because this hair fall is because of miniaturization of the hair follicle. So you have a nice adult hair follicle, which is becoming a baby hair follicle, and then it falls off. So that's where we catch it. We prevent it from becoming a baby hair follicle so that it remains an adult. That happens only with constant sprays which are used to keep the hair in its adult form. So many times fathers who have gotten bald early, they get their sons when they are 13, 14, or when they say that, dad, my hair is falling. And if we can catch them, now it's happening even that early. We can catch them there and give them the sprays then and there, we can prevent that hair fall. So that's the primary cause in men. But of course, we have nutritional deficiencies in men as well. Those who are not eating well, or those who are doing those crash diets and things like that. For them, but that's a very less number compared to women. Women, it's primarily nutritional. Men, it is primarily genetic.
Right. I could have postponed my
You have
baldness.
a strong family history?
Not really. Yeah, my dad is, but my grandpa is not bald. Yeah.
So that's what I tell patients is called the genetic lottery. So we have grandfather who's bald. Then we have the dad with great hair. And then we have a son who's clueless because he thinks dad has good hair, I'm not going to get bald. But then the granddad and grandson do get bald. And the dad continues to have good hair.
Right.
So that's that skip generation, so genetic lottery. We don't know who gets that.
Right. But luckily, I like my baldness. Yeah. I've accepted it.
Yeah.
So now I feel much better than having a hair which you have to maintain and you
I
have to look
totally,
through the mirror.
I
and-
totally agree with you. It does become a lot of people. Yes, yeah.
Yeah, but okay, is there a difference between hair fall and hair thinning?
Yeah.
Like, what is hair thinning and what is hair fall? I mean,
Yeah.
hair fall we know.
Yeah.
What is hair thinning?
Hair thinning is so it depends on how much of blood vessels are supplying your hair follicle, or even in male pattern baldness, it's a adult hair follicle which is gradually becoming a baby hair follicle. So that's thinning of the hair. So let's look at this way, Clinton. If you are flying a drone above a forest and you're seeing the forest is full of thick trees, you're not able to see the ground. So that's a head full of hair. Then you go a little further and then you see that the trees are very thin. And because of the thinning of the trees and the slimness of the trees, the ground is visible. So that's thinning of hair. So you have a hair follicle, but it's struggling to grow. So that's thinning. So we have like a lot of procedures which we do for thinning, struggling hair follicles to give them that boost to become thicker again.
Again, thinning of hair is genetic.
Thinning of hair
Is it lifestyle based?
Yeah, no, I think it's more of genetic based, and it is also seen in women where there is a condition called female pattern baldness. So, I mean, this is something which you will be able to pick up in weddings. So you'll see mom, her sisters, then the daughter all sitting together, and you'll notice that they have this pattern where the front part of the scalp is very thin and their scalps are visible. So that's called female pattern baldness. Though it's not a baldness, it's a thinning of the hair. So there again, girls should be aware if their family has got a pattern of female pattern baldness, and they can do things in their early 20s to prevent it.
So people who don't have family history of thinning hair, they need not
worry as much as the ones who do. Yeah.
So ones who have it, they should come earlier to prevent or postpone the hair loss.
Yeah, that's a good way of looking at it.
Right.
Yeah.
So how do you guys treat the hair thinning? Like, what do you guys do for it?
Okay, so for the thinning of the hair, we have to work on the nutrition to the hair follicle. So we have to give it some sprays which help to improve the vascularity to the scalp. So again, going back to your follicle, you see these blood vessels which are supplying the hair follicle. Now, if these start thinning down and closing, then obviously the hair follicle which is supplied by this also shuts shut. But we are using sprays to help to thicken the hair follicle by increasing the blood supply to it. So very surprisingly, the drug or the chemical which was used to treat hair follicles was started as an antihypertensive. So people with BP would go to their doctor and the doctor would put them on this drug called minoxidil, hoping to reduce their BP, oral tablet. And they figured that, this guy, every time he comes for follow-up, he's happy, his hair is growing well. So there's something happening there. It has showing a tendency of increasing the hair growth as well. So that's when we dermatologists swooped in and we converted that into a spray form.
Wow. Okay.
Yeah, so we're using it topically so that we don't have the need of taking it orally, which, by the way, I do give patients oral minoxidil as well, depending on their history. So suppose the person coming to me has got hair fall and hypertension. So it's a 2-in-1, isn't it? So it helps to control his BP and grow his hair. So I give them oral minoxidil then. But topical minoxidil, I tell the patients very clearly that once you start it and you are enjoying good hair because of it, why would you stop?
Right.
Yeah.
So I heard there's a lot of PCOS in women causing hair fall in young women.
Yeah.
And how does that connection work and what can be done about it?
Yeah.
Like women who are going through PCOS face a lot of hair fall?
Yeah, they do, because the ovaries are ridden with some follicles, and these follicles are producing unnecessary hormones which are messing with the cycle, right? So sometimes when you have a high testosterone level, now as a girl, she doesn't need that. But high testosterone, when men have high testosterone, what happens? They lose the hair. Similarly, it starts happening for women. So, there is this, though they do describe it very clearly, saying that women with PCOS will be slightly obese, they have thinning of the hair, they have pimples on their face, they have irregular periods. That's not the way we see it. Typically, we can have a very lean and fit PCOS as well. When we see thinning of the hair and we see a bit of pimples on the face, the first thing I do is I ask the girl to please do an abdominopelvic ultrasound, because I want to rule out PCOS. But then always that denial, but doc, my periods are normal. Why are you asking me to do it? Normal periods doesn't mean that there is PCOS, right? PCOS can come in multiple ways. Only thinning of the hair and pimples can also be a sign of PCOS. So yes, thinning of the hair is definitely seen in some people with PCOS, and sometimes it can be because of high testosterone. So we give medications to reduce the testosterone and topical minoxidil as well.
In men, high testosterone leads to hair fall, right?
Yeah. Even in men taking whey. So that's the thing now. Now it's everyone's doing whey and creatine and whatnot, and that availability. There are many nephrologists who are also very upset because it is increasing the load on the kidneys. So we are talking about people who are not bodybuilders. We're talking about regular boys, and they want to get muscle definition. So they are having a lot of whey, they're having a lot of creatine, unknowingly increasing the burden on their kidneys and unknowingly increasing their testosterone, which is further enhancing their male pattern baldness.
Does that mean bald men have more testosterone than the regular?
That is we would think that that's the the 1 + 1 = 2. But it also means that they have along the hair follicles they have something called DHT receptors, dihydrotestosterone receptors, which are very prone to testosterone, which causes miniaturization of hair. So that minoxidil we're talking about is a blocker of DHT. So helps to reduce, and there's another drug called finasteride which reduces testosterone in the body. So these are the things that we take the help of.
Is there an evolutionary benefit of losing hair? Like, how have we evolved to lose hair?
So I don't know. See, the thing is that there are a lot of individuals who really don't care about it. And, as doctors, it's very refreshing to meet people who don't care about it at all, because most of the time they reach us when there is no hope. I tell them the bus has almost left the station and then now you're bothered about it. Because once the hair falls and the follicle is not available, there's no chance of hair to grow. So that becomes a typical hair transplantation territory, not hair recovery or salvaging therapy. I don't know about the evolution part of it, but many people accept it as part of their aging profile, which is refreshing, honestly, because it's very difficult to fight for the hair. And even the type of people who are doing the treatment should be highly motivated to use the spray every day.
Right. I mean, there are a lot of commercial products out there on this, and I think most of them are useless and just preying on
yes.
instinct,
Oh,
right?
I can name so many.
Yeah.
But I want.
Okay.
No, but there are a
Even
lot of
advertisements. I can really feel the sad. I mean, people instantly get connected to it, and So, does stress actually cause hair fall?
Think about it, Clinton. The stressful period of our life is when we are young. Finished our studying, we are looking for jobs. So we're talking about 20, 25, around then. So that's when most of the men start showing signs of male pattern baldness, right? So yes, male pattern baldness happening and stress happening is happening at the same time. So it's very tempting to correlate. But stress indirectly causing increase in your dandruff and reducing your cortisol, that can also cause hair fall. Yeah, it can. Extreme periods of stress can definitely cause waves of something called telogen effluvium or hair fall.
So what about after pregnancy or during breastfeeding? Many new mothers complain about severe hair fall.
Yeah.
Is that normal?
That is. But they did enjoy good hair when they're pregnant, isn't it? So during those 9 months, because of the effects of hormones like estrogen and progesterone, the hair doesn't go through the period of shedding at all. So there are periods of anogen or hair growth, and then you have a period of telogen, hair fall, and you have a period of rest in between. So during that period, what happens is, during pregnancy, there's a prolonged anogen phase, hair growth phase. So women don't experience hair fall. It's the best time when there is no hair fall at all. But then what happens once they deliver? That balance of hormones go back to normal, and all that hair which was supposed to shed during pregnancy, it sheds all at once. It normally happens when the child is around 6 months old. Right? So that protective effect of what breastfeeding mothers have, there's a hormone called prolactin, which protects from while they're feeding the child, and then once they stop and the prolactin dips, then everything goes back to normal, how they were before pregnancy, and the hair fall is magnified. So, we tell mothers normally don't stop your supplements of iron till 6 months after you stop breastfeeding, so that the hair follicle gets the iron that's required, because there's so much of loss of nutrients in this.
So it's normal, nothing to worry about.
It's nothing to worry, and it will reverse, but very few percent, like around 5% of women, go into something called chronic telogen effluvium. And we do see many people say, I was okay in my first pregnancy, but then after this one, there will be one poor child sitting there. After this one was born, my hair never became normal, and that poor child will be squirming in the seat. I am the reason for my mom's hair fall. It's not that. It's just that it is a postpartal telogen after pregnancy, and that has never fully recovered because nothing was done there to recover. You should have taken minoxidil then, you should have used the sprays, you should have taken the supplements to prevent it.
So you should consult a dermatologist.
Yeah,
when
it's
you
good.
see,
It's always good because it is so difficult to grow hair. Even the hair that's there on the scalp, to retain it, it's very difficult. Yeah.
You said thyroid problems cause hair fall.
Yeah.
So should everyone with hair fall get their thyroids checked?
I would say not only thyroid, get your iron, B12, D and thyroid checked. Because thyroid is only one part of it. So even people who are taking treatment for thyroid diseases, they do continue to have hair fall because it is one spectrum of hypothyroidism, like with dry skin,
When you talk about all this nutrition, iron, B12, D, so it comes under nutrition territory.
Yeah.
So what are the good nutrition? Like what is the good nutrition for hair growth or hair health?
Yeah. That's a very valid question, actually, which I rely a lot. So in the first, we call it telogen effluvium, hair fall. So in the first consult, I always insist that if a mother is getting her daughter to me for hair fall and we're doing the blood test and she's coming back with the reports, many people say, Doc, can we just WhatsApp the report to you? I have no problem with that usually. But when it comes to a young girl, the advice that I give her now will continue being with her through life, right? So I always insist that they come back and listen to what I have to say. So if they have an iron deficiency, they should be eating food which is rich in iron. So for a non-vegetarian, that's very easy, right? So red meat, liver, all that increases iron. So we encourage them to have that. For vegetarians, a little bit more difficult because most of the iron is there in green leafies. So there's only that much green leafy that you can have every day. But then if you can, use something like drumstick leaves, which are very high in iron content, or if they're making chapatis, puree a bit of spinach and add it in that atta and make chapatis out of it. Or if you're cook in cast iron vessels, which also release a bit of iron into. All those things have to be done consciously to make sure that at least for parents who have young girls who have hair fall, try all this also along with the treatment. So iron supplements are necessary, but you don't take them through life. You start good habits so that you don't have to be on supplements always. So that's with the iron. B12, of course, for non-vegetarians, easy enough. But there are a subgroup of people who have difficulty in absorbing B12, which is eaten. So for them, it's a little difficult. So for them, maybe B12 injections or something like that needs to be given.
Oh.
So a typical non-vegetarian diet is enough for B12. So 2 eggs a day. For people who don't eat hardcore non-vegetarian, just eggs, 2 eggs at least every day. And for vegetarians, a lot of fermented food. So fermented like idlis, dosas, all of them also have B12 yeast related. No? So that's for them. Vitamin D, there's no go. I mean, it's sad, but you have to take the supplements there.
Right.
How much of the sun can you sit in, I mean, we tell people to protect yourself from the sun because there's so many skin diseases that happen because of it.
So what are good hair care practices?
Okay, hair care practices. Okay, so I would say don't use blow dryers very often. Try to air dry your hair as much as possible. Always use surfactant-based shampoos on your scalp, not on the length of the hair, but definitely wash the entire length at least once a week. Because if you're using product on the length, then you don't want that build-up to cause problems. Then you have to eat really well. And when you're thinking about food, think about food which improves your hair growth, because good hair invariably means good health. So people with nice, strong, long, locks, thick hair means that they're doing something right. They're eating well. There's less stress, everything put together, right? So hair health always is a mirror of your body's health.
Why not blowtorch, like blow dry? Like what happens? Like why is it bad?
Because we discussed dandruff, where we said that heat increases the growth, oil production and makes it worse. So that's why. Plus the hair follicles, if you look at it, they're like petals. They are one above the other like this. And when you blow dry, you dry them out and they curl out and they become very rough. So it's better to air dry. Let it dry naturally. than blow dry.
Can you describe me the structure of hair?
Yeah, so the structure of hair is it's almost like an onion peel, right? So it is all like one above the other, the cuticles.
It's not a straight single.
No,
length
it's not.
strand.
It's not.
It's like
Like snake skin almost, It's like sort of overlapping each other. So they are sitting like this, one over the other. And any damage to your cuticle, it's called the cuticle, any damage to that outer structure of the hair can lead to them being not so smooth. And when it's not smooth, it becomes frizzy. So that's what it is. So it is a very smooth structure if all of them are aligned well. So there are many people who use hair dye and chemical treatments and things like that. They mess with the structure of the hair.
hair cuticle.
Yeah, hair cuticle, especially people who do hair Botox to straighten the hair.
Wow.
Yeah,
There's a
so
new thing.
no,
Hair
it's there. But now they call it Botox. It's just hair straightening.
Okay.
So what that does is it breaks that disulfide bond, which keeps the hair structure intact, and it makes it limp. So a naturally curly hair loses that curl and it just falls straight. So it feels good to manage it and maintain it, but in the long run, it's very bad for the length of the hair. You're damaging the cuticle. You're doing stuff to break the bonds between the cuticle.
Does shampooing cause hair fall? Should people reduce how often they wash their hair?
No, shampooing, if done correctly, does not cause hair fall. It has to be done on the scalp. It should not be done throughout the hair length. And for women, it should be done at least 3 times a week. That's the basic minimum. Now, if we are talking about athletes, people who are running a lot, who are swimming a lot, and who are in contact with chlorine and the hair is damp, please do wash your hair, because if not, then there's more damage to your hair from the chlorine and from the sweat rather than from washing itself.
When should someone consider a medical treatment for hair fall? Like what options are available for a treatment?
For hair fall, I think it is wise to consult a doctor. If you are doing things at home, you've done all your DIY home remedies, and you're saying that, it's not getting any better. So first you got to be evaluated to figure out why your hair is falling. So that's what I tell all my patients all the time. First find out why your hair is falling. And once you fix the why, and that usually means that you're fixing some problem in the body, then the hair fall becomes. So use your hair as a marker for your health. It's not the other way around. We are not stopping the hair fall just by treating it from outside. You are finding out why it is falling, because in a good milieu, if your environment is good, your food is good, then the hair should not fall.
It's just to do with the, what is that chemical? Minoxidil.
So that we're talking about male pattern baldness.
Okay.
So that is, of course, male pattern baldness. It's pure science, maths. We're trying to increase the blood supply to the hair follicle, trying to reduce the activity of DHT, dihydrotestosterone. So there we talk minoxidil, finasteride, sprays, oral medications. Now coming to the telogen effluvium, which is because of
female.
nutritional,
Okay.
So there we're talking about supplements, supplementing what is lost, or using good biotin-based multivitamins and some omega-3 fatty acids. Things which improve the blood supply to the scalp.
So this minoxidil, you have to keep using it, is it?
Yeah.
Like
Yeah.
throughout your life.
Yeah.
To stop.
As a prophylactic
filling,
measure to stop, you have it in your family and it's starting early in you. So you're saying that, let me wait a little longer. I need my hair. So till you need your hair, you've got to use it.
Okay. So I heard about this PRP treatment for hair fall, platelet-rich plasma injections. So is there any science behind it, or just hype or something expensive stuff?
I wouldn't call it expensive. It is not very compared to hair transplant.
Okay.
So PRP, platelet-rich plasma, or GFC, we call it, growth factors. So that's one step ahead of PRP, where only the growth factors in your blood. So say you have come to me and you've said my hair is falling, and I've said, okay, let's check what's happening. And then we see that there are some deficiencies. I fix the deficiencies. I ask you to take the treatment for 3 months. And in 3 months, everything is fixed. It also means that the quality of your blood is great because you've taken so many supplements. Your plasma has got all the platelets, got all the good stuff happening. So then the question comes, why not use it directly to help your hair to grow? So we'll take 5 ml of your blood. We spin it down. And when we spin it, most of the red blood cells settle down to form a red plug down, like a plug. And the stuff which is remaining on top is a straw-colored liquid. That's plasma. So we draw the straw-colored liquid in some syringes, and then we spray it on your scalp, and we use a micro-needling device to rub that plasma onto the scalp.
Interesting.
Yes, so it goes up to 1 to 1.5 mm deep, and it helps the hair which is growing there to become thicker. So it's a direct stimulation of the hair follicle. So it's like putting fertilizer for a plant. So you're noticing there's a plant struggling to grow. The roots are intact. Then you put a bit of fertilizer and it grows a little thicker and stronger. So we need the plant there. If the plant is there, PRP will work. So it will not work for people who don't have hair. It will work only for people whose hair is there but struggling to grow.
Okay, interesting. So it actually, it does work.
It works beautifully well. Yeah.
Okay, better than minoxidil?
So minoxidil is like ghar ka khana, you're eating every day. PRP is like going to a hotel, rarely, and having a buffet breakfast.
Okay.
So it's like that. So
how much
it is
would
an
it
add-on.
cost?
It's around, it should be anywhere in Bangalore between 6 to 9K, depending on where you're getting it done. But that's the basic cost for PRP. It is done once every month for 4 months.
Okay, it's a 4-month-long therapy.
Which is done monthly once.
Okay.
At the end of 4 months, you get a plateau. You get hair which is getting better and better and better with every treatment, and then it reaches a plateau. So I tell patients, though they insist, no, let's keep doing it. So I tell them after 4 sessions, give it a break. Do the rest of your stuff. And then come back to me maybe once in 3 months or once in 6 months, whenever you feel you're losing density.
So this whole 4-month duration treatment would cost 6 to 9K.
No, every session costs.
Every session costs 6 to 9K.
Yeah.
So if there is no visible change, would cosmologists return the money?
No, they will be. So that's the thing, right? So I have a lot of patients who tell me, Doc, we've done 13, 14 PRPs outside. I've not seen any changes. So then when you ask them, where is this outside? You figure out that it's been done, like you said, by cosmetologists who are not dermatologists. They may be dentists, they might be MBBS doctors who have done a course in cosmetology, and then they do these procedures. So I have a lot of patients who have unwittingly fallen prey to these quacks who consider themselves to be dermatologists. So, my sincere request is, whenever you meet a dermatologist, you will have that dermatologist KMC number or whatever, wherever they're practicing, their number and their affiliation to their dermatology MD written on their prescription. If they are not writing that, it means that they are not a dermatologist. So be careful, because then when you do procedures with them, you don't get results.
Right.
But PRP always works.
People don't know the difference between dermatologist, cosmetologist, aesthetic clinic.
Yes.
So these are 3 things, right?
Yes.
So how do you tell the difference between a dermatologist, cosmetologist, and aesthetic clinics?
Full disclosure, all dermatologists will write their MD, DVL, dermatology, venerology, and leprosy, right there. So you know that this person has done their MD or diploma in dermatology. But there are a few courses which, after MBBS or after you do your BDS dental, you do like a month or 2 in some cosmetic thing. So they won't have the full knowledge of the skin, or even if things go wrong, they wouldn't know how to manage it. But they will be doing procedures. So I caution patients to be careful about that. It's very easy to fall prey to business people.
And those aesthetic clinic chains.
Yes.
So are those conducted, run by dermatologists or business people?
Most of them do. So if you are careful enough to ask your doctor, are you a dermatologist? They will tell you if they are one.
Always go to a dermatologist.
Always go to a dermatologist for skin concerns.
And hair transplant seems to be everywhere now. So when is that a good option? And what should people know before considering it?
Yeah, so hair transplant or HT, it is not my area of interest, because it is
area of its own.
It is a separate area and a very monotonous area of its own, where I feel that is one of the first things which are going to be mechanized when it comes to our medical area, because it's all about taking follicles from your occipital area and transplanting it to the front part of the scalp, right? So there are groups of individuals who are HT or hair transplant specialists who go from clinic to clinic offering their services, where they'll do a fantastic job of harvesting follicles from the occipital area and delivering it to the area where there are no hair follicles and no chance of hair follicles growing as well. It is a very cumbersome, laborious process. It takes almost a whole day to do it. But if done right, it can give beautiful results.
Like if you look at some tech CEOs like Elon Musk, and
Yeah.
they were all bald before.
Yeah.
So now you can't think like that person had a
Yeah.
baldness. So
Yeah.
what do billionaires go through differently than regular people in?
I think they choose the best place to get their hair transplant done, and they probably keep going for touch-ups and things like that in between, because there is a maintenance which is associated. We spoke about PRP. So after doing your hair transplant, the transplanted follicles require all the TLC that you can offer. So that's when PRPs and things are done for those follicles to help them to grow. So these guys definitely are doing their minoxidil, they're doing their sprays, they're doing PRPs, they're doing things at particular periods of time, intervals of time, to look the way they do. It's not only for their hair, it's also for their skin. So you notice that wealth has a shine associated to it, right? So all these successful guys, their skin is glowing, their hair is very dense. That's because they are doing what it takes to get that, yeah.
Means it's expensive.
Yeah, so that's the shine of wealth.
Right.
Yeah.
So you mentioned supplements. So biotin, hair vitamins,
Yeah.
collagen powders. So
Collagen, I'm
are
not.
they worth the money?
Not the collagen part of it. For non-vegetarians asking me about collagen, I always shoot them down. I mean, they are having collagen anyway. So some vegetarians like to take marine collagen. I'm not the right person to be commenting on that, because collagen is something which is broken down in the stomach. Now, it getting absorbed and then going to the hair follicle is a far-fetched imagination.
Unlikely, right.
But biotin, yes. Selenium, yes. Omega-3 fatty acids, yes.
Okay, so collagen. So it's a buzzword if they see a collagen mentioned in the supplements or whatever.
Yeah.
So just be careful with the collagen.
It's big.
term.
It's big. Collagen, rosemary.
Okay. What is rosemary?
A poor man's minoxidil, I would say.
Okay. So what's happening in the air fall industry that you see? Like, most people should be aware of.
Yeah.
So that they don't fall prey to those things, so that they take very informed choices or make better decisions.
Yeah.
Not make decision based out of what somebody has, what propaganda or marketing is saying, or not fall prey for their insecurities and you start believing whatever, the market is saying. So, what's happening in the, how people are falling prey for these things and what is right, what is wrong.
Yeah. I don't know. See, I always imagine, as a dermatologist, I'm going through my Instagram, and then there are these all happy people with nice, shiny skin and long, lustrous hair. And maybe there is a person who's scrolling and she's very insecure because she's got acne, she's got pimples, she's losing her hair. And then the next thing, you are going towards one of those big chains of companies which have come up with packages for hair fall. So you do this is pack 1. Then after 3 months, you do pack 2. And then you take that entire package and we'll keep sending you the stuff and you keep applying it. No questions asked. So the first thing you would do is, why can't I keep my hair? And then you click on shop now and you go and buy it. Right? So they do prey on insecurities of patients. And one thing the consumers should know is that not all hair fall is the same first. And there is a medical way of treating it safely without causing side effects for you, rather than go blindly on a company which is claiming to. They have that entire package. It's very difficult to not fall prey for it.
Right.
They give it to you with the comb and that how to apply, and very beautifully packed, and it arrives home in a nice customized cardboard box. Many patients get it to show it to us. So, I would say, our medical stuff looks very boring in comparison to that. But the boring stuff works. And we know everything about it. We know what can go wrong with it. So we'll be able to guide you a little better as to how to apply, how much is good, when to worry, rather than just going for one size fits all.
So when you said hair fall has variations, not all hair fall is the same.
Yeah, and not all can be treated also, right? So we have something called scarring alopecias. Alopecia areata, where people lose hair in chunks, like there are bald patches in between. So that's a disease. That's not a cosmetic problem. And you'd be surprised to know how these chains of homeopathic clinic prey on patients like this and make them undergo PRPs and things like that. Wherein PRP is not the treatment there. What is the treatment there is a medical reason. Find out and treat that. That's not done. So they lose so much time, and by the time they reach us, they've reached stages where it's irreversible.
Does cutting your hair make it grow back thicker and stronger? They say if you have hair loss, just trim it off. Then you get a new, thicker and stronger hair.
Yeah. So, I mean, it feels nice, isn't it? Like, say you are undergoing a lot of hair fall, go to a good hairdresser and they cut it in beautiful layers, which gives that nice bounce and feel to it. So you temporarily forget about the hair fall because it's cut in a way that it's making it look voluminous. There is also this, it is in many customs, it's there where they shave the hair of the child after a year or two and allow the new hair to grow. That has got some scientific background to it because the hair which the child is born with, that will eventually get shed. So you shave it and then the normal hair starts growing. But when it comes to adults, the growth of the hair follicle is not dependent on shaving the length of the hair follicle, right? Unless you have something called split ends, wherein you have been combing your hair very roughly and that rough combing causes your hair follicle to split into two. It just splits down the middle. So that time the hair can't grow because it's damaged, it's injured. So in such patients, cutting your hair will allow the hair to grow. Yes, I agree.
So can hair fall be reversed, or once it's gone, is it gone forever?
It depends on which type of hair fall. So male pattern baldness, once it's gone, baby gone. There's no getting back the follicle. For females, if it is thinning, we can thicken your hair. For people with alopecia areata, where you have lost hair because of some autoimmune problem, we'll find the reason and fix it and your hair comes back. But there are a subgroup of people, we call it female frontal alopecia. It's a fibrosing alopecia, which means what? Your hair has fallen from this tract and then, unlucky for you, the tract closes. There's no chance of hair growing there. So it's very rare, thankfully, and less than 1% of the population, female population, suffer from it. Their hair gradually starts going behind. The forehead gradually starts getting bigger. There is no treatment for that. Absolutely none, because it is an autoimmune condition and the hair follicle just closes up. There is no chance of hair to regrow. Those are called scarring alopecias. Also, there's a condition called LPP, lichen planopilaris. There also the hair falls and it doesn't grow back again.
Those are pretty rare.
They are luckily rare, yeah. But if caught early, we can prevent it.
Give us your top 3 or 5 practical tips someone can start doing today if they are concerned about their hair fall. Okay,
so we are doing nutritional hair fall, right? So improve your diet, be very conscious about what you're eating, and eat a lot of colored fruit and vegetables in your diet because these are vitamins and these are very crucial for your hair to grow. Increase protein intake because at the end of the day, hair is a protein, right? So you want good protein intake so the output of hair is also good. Don't dry brush your hair, and people with curly hair, please learn how to take care of curly hair rather than going and straightening it because that's the easy way out. Right? Curly hair is definitely much more appealing because it adds good frame to the face. So learn how to take care of it. People with straight hair, don't over brush your hair. Please don't over oil your scalp as well. And wash your hair regularly on the scalp.
Okay, let's talk about curly hair. Very interesting topic. Yeah. So what's different with the people with the curly hair than the straight hair?
Yeah.
And what do you see people with curly hair doing wrong and how to take care of curly hair better?
So I think the people with curly hair, if they grow up with a mother who's got straight hair, it's hell for them because mom has got straight hair. So she's used to washing her hair and combing it out and your hair is straight. Because the waviness or the curliness of the hair depends the angle at which the hair is exiting your scalp. So in Asians, in our Chinese and Japanese population, it exits perpendicular. So it is like nice and straight. The rest, it comes at an angle. So then it curls. So that it depends on the angle at which the hair exits the scalp. So people with curly hair, please do not comb your hair. That's a huge mistake.
Okay.
Huge mistake because your hair is naturally curly. Like you're having a bath. You have washed your scalp. You have washed your hair with conditioner, you're rinsing it out, you're scrunching it with a dry microfiber towel, you're putting in your curly girl products, and then you just crunch it and leave it and allow it to hair dry. Please don't comb your hair, because if you're going to comb your hair, that beautiful structure that has formed, those rings, that breaks open and then it becomes frizzy. So many people come saying that my hair is frizzy, no matter what I do, it's still frizzy. It is frizzy because of what you are doing. So stop messing with your hair. Allow it to dry naturally.
And people go through straightening, hair straightening. Does it really affect the hair health or hair stability?
Yeah, it is very bad for the hair, right? So most of the hair straightening is
let's
done.
address it then.
Yeah.
So why hair straightening is bad for hair? Like what happens?
Yeah, it is. It breaks the disulfide bonds in the hair. So your hair stands a particular way it does because of something called disulfide bonds. They give that bounce and curl to the hair. Now you're saying, okay, I don't want the bounce. I want my hair to be poker straight. So you're breaking the bonds. Wherever bonds are broken, the structure of the hair follicle becomes weak. So then it becomes brittle, it breaks more. So in the long run, it's serving no purpose at all. Rather, people with very curly, even in curly hair, there are degrees of curls, right? People with very curly hair, there is a way to learn how to, find out the porosity of your hair. There are many sites which tell you how to figure out what type of curl you are, and they tell you what type of product to use for your hair. So you don't have to follow everything they tell you. You have to try with small amount of product yourself, find out what suits you and continue using it.
Like what products? Products for what?
For curly hair, to keep it curled. So you have things like leave-in conditioners. They condition the length of the hair. And one thing that curly hair always gets is frizz, right? So we are trying to keep the hair curly without making it too frizzy. So those are called leave-in conditioners. And then you coat it with gels which allow it to keep that natural curl structure on.
Yeah, we covered hair fall. Then I think before we come to other condition like acne and pigmentation, dark circle, I think it's better to understand skin, like its anatomy, how it works, what are the different layers in skin, what are its functions. And most of us walk around without knowing what our skin, how sophisticated the skin is.
Yes.
So we just take it as outer covering.
Yeah.
And in my high school textbook, I read this is the largest
organ in the body. It is,
right?
Yeah.
So why is it the largest organ? Like I just see it's very it doesn't look like organ, liver or heart.
Yeah.
So skin, we take it differently. So help me visualize this better.
So skin is the largest organ in terms of volume.
Okay.
Right? So, if we open up our skin and we lay it down, it is large, it is huge, and it has got a large impact on whatever is happening inside our body. So, basically, the structure you needed to learn, right? So, the structure of the skin, I'll put it very simply, is divided into the top and the bottom part. So, we have the top part, which is called the epidermis, and the bottom part, which is called the dermis, and then we have the subcutaneous fat under that. So, there are many diseases which happen at all three levels.
Okay.
And in the skin, you have your sweat glands, you have your oil glands, you have your hair follicle, you have so many nerve endings which are reaching there, which gives you that feeling of touch. You have so many blood vessels reaching there, and you have muscles attached to the skin as well.
Wow.
So it's a very complex organ, and it is also an organ which has got a lot of stuff happening in that epidermal part where your skin is constantly shedding every 2 weeks. So every dermatologist's prescription will have medication to take for 2 weeks. Why 2 weeks? 2 weeks is the time required for a cell which is sitting in the basement to reach the top and get shed off. So for the entire life cycle, if you take the medication, the chances of the disease reoccurring is less. So that's the funda behind 2 weeks, and that is the structure of the skin.
So the top layer, you mean like the thing we touch?
Yes.
Right.
Yes,
so is it actually dead cells, is it? Or is it living material?
No, they are dead cells, corneocytes. So
these are all dead cells?
Dead cells, which are shedding, and they shed even if you don't scrub your skin. So there are many people during bath, they love taking those loofahs because they're seeing the skin cells shed off, which is what it will do even if you don't scrub it. So we are not big fans of loofahs at all, because the more you rub your skin, the more the skin feels there is some insult happening to it, the thicker it tries to become to protect itself from you. It's very, very, proactive. it takes feedback from how you're treating it. If there's a particular area where you're rubbing constantly, or a shoe which is not fitting you well, that area of the shoe which constantly rubs on your skin, the skin there becomes thick to protect itself from the trauma. So skin is very, it takes feedback from you. So you don't have to scrub your skin. That top layer will shed off even if you don't scrub it.
Okay.
So it should be a very gentle, take care of your skin well. Okay. Quick bath.
Is all skin basically the same, or are there fundamental differences between different skin types and tones?
It depends on how many melanocytes, which are, very interesting and very... so here in the epidermis, you have like for every 10 skin cells simply sitting there, you have one cell, which is like an octopus, right? It is sitting over there and it's got tentacles which are radiating upwards, and they are discharging something called melanin. Melanin is pigment of the skin. So you'd notice that if you're going on a trek or if you're going swimming on a hot day, the parts which are exposed to the sun are much darker than the parts which have been covered by a simple garment, because the parts which are exposed have triggered those melanocytes to produce more melanin, because the job of the melanocyte is to protect you by discharging melanin. Right? So that's the melanocytes. That's the pigment of this. So Caucasian skin has got less melanocytes. Indian skin a little bit more, and African skin the most number of melanocytes.
Apart from protection from the sunlight and melanocyte, does it serve any other function? Like, is its function is just to protect you from harsh radiation?
Yes, it is a protective, and it has got some antioxidant kind of. So, loss of melanocytes is diseases like vitiligo, right? Wherein your body is not able to recognize the melanocyte. But unfortunately, it is attacking it. So the area where the body attacks the melanocyte, there is zero pigment, white, milky white. So those are diseases like vitiligo, autoimmune. So
those are the people who seem very without pigmentation.
That is albinism, entire body. They're born with it, right? No melanocytes. Neither on the body nor in the black of the eye. So that is different. But yes, that's a disease of the melanin pigmentation. But here we're talking about an autoimmune condition where your normal melanocytes are not functioning well enough.
It's called vitiligo.
Vitiligo.
So how common is that, and how do you treat those?
It's unfortunately not very common, and we treat it by reducing that inflammatory cells which are going and attacking your the melanocytes.
And we have all heard the terms oily skin, dry skin everywhere. So is that a matter of concern, having both the skin type?
Yeah, no, that is a very good question, because many people will come and ask, Doc, what is my skin type? That is after washing their face and coming. So that should make us like a astrologer to find out what it is, because they would... So the skin type will be very easily determined when you wake up in the morning, when you don't have anything on your face, right? So naturally dry skin will feel dry and stretched in the morning. Oily skin will have a shine to it in the morning. But you'll be surprised to know that your skin doesn't remain the same throughout the seasons. So in summers, it'll be more oily. In winters, it'll be more dry. And then even with age, every 10 years of your life, your skin keeps changing. More so for women. Because after menopause, the skin becomes very dry. So whatever skin routine you were using in your younger years will not continue to hold good later on. So you have to rethink your skincare routine every 10 years.
How does our skin change with our age? Like what's happening underneath that creates those wrinkles and sagging?
Yeah, that's all collagen.
Okay, lost collagen.
And the biggest trigger for skin aging is the sun.
Okay.
The sun and your diet, of course, because now, say there's a person, so they did this, there was a very interesting study. In Ireland, there was this mailman who would travel the same route every day from his pickup point till the post office. And when he would come back, when he was going, the sun would fall. Of course, they drive on the left side of the road, right? So when he was driving to his post office, the sun would fall on the left side. And when he was going home, he was going the other way, and the sun would reach the other side and it would still fall on the left side of the face itself. So he was following the same route for 20 years. And the picture of him shows how one side of his face has aged so rapidly compared to the part which was away from the sun. So the sun is a huge deterrent to skin health, because it has got a lot of, under your skin you have a lot of collagen. And that collagen can get destroyed very easily by narrowband UVB, UVA light, which come in contact with the skin. So we in Bangalore, we are at a plateau. We are closer to the sun. In Bangalore, we are at sea level. So we're actually far away and we sweat. Skin is well moisturized. So sun damage there is very less compared to sun damage in higher altitudes.
Oh.
The higher you go, the closer to the sun, the more precautions you should take not to be out when the sun is overhead.
So the aging happens because of loss in collagen.
Loss in collagen and more pigmentation, melanocytes also start producing a lot of unnecessary melanin here and there.
Right. What to do with the collagen longevity?
Yeah. Procedures.
Okay.
Or, there is a lot of buzz about retinol creams because retinol creams are known to increase collagen, superficial collagen production. And they help to increase the skin cell turnover. We spoke about 2 weeks, how it takes a skin cell to travel and fall. So this retinols increase the skin cell turnover and make new cells form rapidly. Vitamin A, that's retinol, right? So here, how to increase collagen is by injecting PRP under the skin, some micro damage like with laser. So the skin feels it's under attack and lays down collagen. So that's how you fool the skin into producing more collagen.
From dermatological perspective, what does healthy skin look like?
Okay, dermatology perspective one, and then even a regular person's perspective. So when you look at a person with healthy skin, one is that there should be even pigmentation all over the face. The light distribution bouncing off the face should be even. That gives the glow on the skin. So if they've had pimples growing up and there have been pits on the skin, so again the light distribution there is varied, isn't it? So there'll be patchy distribution of light. So it should be elastic, should be like firm. It should have good pigmentation throughout and it should be even. Light bouncing off the skin should be even. So that's like a definition of good skin.
That's on the cosmetic part,
Yes.
right? On how it looks.
Yes.
And in terms of functioning of skin,
Yeah.
like does the ratio between sweat glands and oil glands, those things, like does producing more sweat means you have bad skin or something?
So that more sweat is more relevant to people who have got a condition called hyperhidrosis. So they have very sweaty palms and soles, which is maybe it is natural to them, or it could be when they were put in a situation of stress where they start producing a bit. So that is called hyperhidrosis, not related to the skin per se, but to the nerves which are supplying your sweat glands.
Okay. Yeah, our lips are also skin, no? Okay, how they are different from other skin in the body?
They don't have much melanocytes and they are very richly supplied by blood vessels. That's the reason why they look a little pinkish compared to the rest of the face. So, but there are many people who face problems there as well, where there is pigmentation of the lips and things like that. Where some of the skin cells, this is called epidermotropism. It goes into the lip and it makes it look a little darker.
Right. And even when you smoke and it gets darker, right?
Darker, or if you continuously smoke, the heat can cause a little bit of not darker but lighter loss of melanocytes at the filter tip which is placed inside the mouth.
Is it reversible or irreversible?
Early stages, yes. But then if it's happening constantly and the person is a chain smoker, it is very difficult if the insult continues to reverse it. Yeah.
So next topic, big topic, acne. All of whom I know, so they all have faced acne in their life. And the teenagers are more susceptible to it. And even adults, I've seen adults having like post-20 struggling with acne.
Yes.
And so really a psychological toll. I've seen people not stepping out of their house just because they have acne.
Yeah.
And even I've heard incidents where students not coming to class or colleges, just thinking what others would perceive them as with acne. So it's not just a medical condition, it's just also a psychological condition.
Yes.
But I don't think people realize what's happening in the skin when acne breaks out. So let's go to the basics. So what is acne and what's wrong with the skin when pimple breaks out?
So very simply put, acne is a disease of the pilosebaceous glands. So pilosebaceous glands are what? You know that hair follicle structure? You have these oil glands sitting there. Now these oil glands are very sensitive to certain stimuli around. It could be hormones, it could be food, it could even be stress, where it's producing more oil, and it can be genetic. So if there's a family history of strong acne, you can be well sure that the children have also inherited the same type of oil glands. So as a parent, what you should be doing is you should be getting the child early for treatment so that we can prevent the scars which come after acne. So I know that everyone is worried about acne, but we as dermatologists are more worried about the side effects of acne. That's the pigmentation, those black marks,
Acne scars.
and the pits that are left behind. It is extremely difficult to get rid of it. So we would rather have patients come in early so we can prevent the acne, right? And because dealing with acne scars takes a lot of commitment from the patient side. It can be done, but it takes a lot of time and effort to get rid of scars.
Right.
So it is a disease of those glands. So there are some stimuli for the gland, right? It can be hormones. So there are some changes in the hormones happening, and that's triggering the acne. So in males, it can be a sudden surge in testosterone. In women also, we spoke about PCOS, where they have increased insulin or testosterone, which can cause acne because that oil glands are producing a lot of oil. And that is not unable to get out of that thin duct, and it's getting blocked, it's getting infected because that oil is rich in certain substances in which bacteria can grow. It's becoming a pus, and that pus is leaving a scar. So that's the cycle.
Acne is like overswelled oil gland with the microbes in it.
Yes, it's called P. acne, Pityrosporum. That is the one which likes to grow in that oil secretion. It's a bacteria. So part of the acne treatment is also antibiotic treatment to help to reduce the amount of bacteria on the skin.
It would start as stages, beginning and then
Yes, there are many
mild
stages.
and-
Yes. So we have grade 1 to grade 3.
Okay.
Grade 3 being the worst, and grade 1 being mild acne. If we can, capture patients at grade 1 and teach them how to take care of the skin and prevent scars, that would be a success.
How would grade 3 acne looks like?
So there'll be a lot of non-burst pimples. So there'll be skin-colored papules, all over, papules we call it. Sometimes with pus, sometimes with blood, sometimes with just swellings, that's it, which are clean. Then you have very bad variant. We do get to see the worst case scenario where it is matted. Now the patient has got so much acne, they give up on their skin. They don't wash their face. They allow it to become like almost matted, right? So that's grade 4. Very rare to see in our setup, in an urban setup, but it still does happen in people who are undergoing depression and things like that. So it's already paid a toll on the way they are seeing their face, and then they stop caring for it and they keep pinching it, and it gets worse. Yeah.
So even in the stage 1, they have outgrown skin.
Mild pimples which are just about starting, which don't look dangerous at all, but they come in certain zones, like cheeks. They come on the forehead. They come on the chin.
No, sometime right over the nose.
Wherever there are big oil glands, right? So that's the early acne. Then you said you know a few people struggling with acne in later parts of life.
Right.
That is called acne tarda. That is more difficult to treat because that is jawline acne, and they are extremely painful.
For
and
adults,
it's in women undergoing that perimenopausal period. And then there are those people who have gone and taken shots of B12 to improve their B12, and they are gifted acne as part of buy one, get one. So B12 injections increase the oil production in some patients, not in all patients.
So B12 given as air supplement would
No,
increase.
B12 given as a injection,
Okay.
as a shot, can increase oil production, which can lead to acne.
Okay.
And in people who've never had acne, they don't know what on earth is happening. They've done only good stuff for themselves and they end up having acne. So we do see.
Almost all the teens have seen, I think, almost go through acne phase.
80%?
80%? Okay. What's with the special 20%?
I think they have learnt early what their skin type is. They have understood that they need to wash their face twice to reduce the number of P. acnes, right? They also are good with their dietary habits. They don't binge on maida, milk, sugar,
Okay.
the known triggers for acne. They don't do that. They are very physically active. So they get through adolescence quite scot-free without acne.
Right.
Yeah.
You had acne?
Growing up, till we figured out why it was coming, right? So a very few, not too many. I mean, not traumatizingly more like what I normally see. in young children. But yeah, it is a part of growing up, and as long as you don't allow it to scar, you're good.
Okay, so most of the people have habit of, even I had habit of pinching it off
Yeah.
and drying it off
Yeah.
and taking it off. It's very satisfactory, but
Yeah.
I think it's worse than keeping the acne as it is.
Yeah.
Like pinching the acne.
Yeah.
So
Because
what do you say about
yeah,
that?
I think so, because around 20% of the stuff that you see, that's all comes out. The rest stays in.
Oh, okay.
And it causes more inflammation, or worst possible scenario, it can burst under instead of bursting over. And that can cause something called cystic acne that causes huge scars.
Oh, okay.
Yeah.
So pinching is
Not
worst
recommended at all. Yeah.
So even if you take care of your skin well, like wash pretty frequently and you take a good care of it, would that guarantee you not having acne?
Yeah, so that's a good question, because acne is usually multifactorial. It is not because of one reason. So if you have a person who's eating unhealthy, you asked about food. So we're talking about all the easy food, that's maida based food, all the bakery related items, milk related. Too much of milk is not good for the body. It increases inflammation, increases acne, and sugar. These are the three known triggers for acne, right? So it increases the oil production, and it makes a person more prone to acne. So clean eating is very important in preventing acne. Then you have that factor of not using the right face wash. Maybe you're not using something which has got salicylic acid, which is allowing the pores to open up, allowing the oil to come out. So that is one. And then you have things like stressors or genes, which you can't do anything about. You have inherited large oil glands. You've got to take some medications to reduce the size of the oil gland.
They come at the time of where like students have huge stress, like exam load, or even for adults when they have like important interviews or meetings. So I know my cousin who had acne coming out right before a wedding, so huge acne on the neck. So I kind of feel there's a relation between stress or like with the acne.
Yes,
so,
there is definitely a relationship between stress and acne. And most of the people who've had silent acne, very latent, just like a what you can say, volcano, very quiet, sitting there, troubling on and off, but not always. But then when there's a lot of stress and pressure, it does erupt, right? And unfortunately before important events. So there's nothing much that we can do if they come at a 24 or 48 hour notice. Rather than mask it up with makeup, there's nothing else. But then how difficult it is to hide a big fat people sitting at a strategic location just before a major event. It is difficult. So now you have pimple patches which has got salicylic acid, or it's got a little bit of an hydrocolloid, we call it, which absorbs all that stuff coming out, and then you can just throw that patch away. So those are some things that we have now which are not there before. So those are your SOS kind of treatment.
It's like a bandit, is it?
It is almost like a transparent gel sheet which you apply on the acne, and it's a hydrocolloid dressing. So it absorbs, it's like how you would dress a regular wound. It absorbs all the secretions coming out, in this case pus, and it sort of, you can throw it out.
Wow.
Yeah.
So, I mean, the teenage acne we can understand is because of hormonal imbalance and things like that. But adult acne, you would say it is triggered by the nutritional choices of the individual, or?
I think it's the other way around. The children are the ones who eat the wrong stuff. Some adults do as well. But adult acne is beyond 30-35, especially women who have painful acne, which is at the jawline. So this is difficult to treat. Plus, it leaves a lot of scars. And you can imagine the annoyance of the person who's always had clear skin, and then close to their menopause or perimenopause, that's when the acne starts coming out. So that is a sign of some changes in the hormones inside the body.
So how do you, as a dermatologist, deal with those painful acne?
So we have to give stuff immediately, medications, to stop the oil glands from being hyperproductive. So there are some, it's called retinols, the tablets. We give them to shrink the glands so that they don't burst up. And then we give some anti-inflammatory multivitamins to reduce inflammation in the oil follicles. That's it.
Okay, that would do the job.
Yeah, it has to be done orally. It cannot be done with creams.
So, pretty curious how hormonal imbalance leads to acne. Like you mean hormone deal with the overproduction of oil glands?
Oil glands, yes.
Okay.
That's the route, right?
Okay.
So especially hormones like testosterone, insulin, they have a direct impact on the oil glands, and they modulate the amount of oil that is secreted by the oil glands. So sometimes that food that we discussed, maida, milk, sugar, they are stimulants for insulin.
Right.
They peak the insulin level, and along with that, they peak the production of oil and they increase inflammation.
So if you have a sweet tooth, that means you're more
It's
susceptible to have.
so difficult for people with sweet tooth to control acne.
What do you see as a dermatologist? Biggest mistake people make on acne, like, that makes the acne worse?
They put toothpaste on the acne.
Toothpaste on the acne. Okay, interesting.
Yes, and this is done by people well into their 30s and 40s as well. So, for some reason, people always believe that toothpaste helps to reduce acne. I'm yet to understand the science behind that. Maybe it is the menthol in it which gives a cooling sensation or something like that. But that's not the right way. Definitely, it will not help. So, that is one thing. Two is, we discussed oil on the scalp, right? Oil on the scalp is a huge trigger for forehead acne.
Okay.
Forehead acne is caused because of over-oiling of the scalp. The other thing that is, now people do dry rubbing, dry brushing. That is a new fad. So they have this tiny little thing to remove the dead skin, which would fall naturally by itself, but they are in a hurry to get it out. So in that process, they end up, over rubbing and over stimulating the oil glands, and fine pimples start coming on the area. There are people who wax their face.
Right.
Removal of hair by waxing, applying cold wax or hot wax and plucking it out. When the hair is regrowing, it pokes the skin and causes acne as well. Oiling the face. Yes. There are many proponents of put oil on your face at night. So you oil the face, you end up over blocking those oil glands and increasing acne. It's not a good idea at all. So we see a lot of people. Now we are talking about people well into their 40s and 50s. Those who had a good run, and then suddenly someone told them, why don't you use this oil? Very expensive, very good oil, and it's great for the skin. So, obviously they are not going to see their skin that close enough. But then when we see it under a dermatoscope, we see fine blockages all over and that causes acne.
Wow.
Yeah, so oil on the face is never a good idea. Your skin is blessed with good oil glands which produce oil by themselves, how much you need. Sometimes it produces more, which causes acne. That we can help you with. But otherwise, putting oil externally on your face, not a good idea. Ceramide-based moisturizers, yes, please do it.
So, should someone with acne wash their face more often?
Not more often than 2 times a day. Like suppose you're in sport and you're sweating out a lot, then one time in between when you come home with plain water is good enough. But twice a day with a good salicylic based cleanser, please do it.
You mentioned one, salicylic acid. What are the other ingredients should someone with acne look for in the skincare products?
So a person with very oily skin should definitely look for sally, something which increases the skin turnover and reduces the adhesion between the skin cells, because you want to open up the pores. Sally is the great.
So the role of salicylic acid is to open up the skin pores.
So salicylic acid digests the skin, the creams, the gels and the face washes as well. Then you have something with benzoyl peroxide. So these are peroxides. So they oxidize the bacterial part and they reduce the growth of bacteria.
It's like antimicrobial.
Yeah, peroxide washes are great. Sally washes are great. These two. And there are people with dry skin also who have acne. Maybe because of the wrong food they are eating. So for them, we don't insist on salicylic acid to wash because it makes the skin more dry. So regular non-foaming face wash is good enough, along with dietary measures. And
even retinoids are given as prescription for acne?
Both oral and topical as well.
So how does that work?
So they help to reduce the size of the oil glands. And they are also something which are called keratolytics. They increase the skin cell proliferation. So they help the skin to turn over faster, and they reduce blockages in that pilosebaceous gland.
Let's see if there are any myths in pimples.
So many.
Yeah?
So many myths.
Yeah, you mentioned one, applying toothpaste on pimples.
Toothpaste on pimples. Then we have
squeezing pimples.
That is always there. Squeezing pimples is main, like they want to try to get most of that gunk out. Most of it is application of home-based remedies itself on the skin, which further potentiate blockages of the oil gland.
As you said, applying oil on.
Yeah.
So can acne spread from one person to another? Should people not share towels or pillowcases?
No, it does not spread from one person because it is very intrinsic
Right.
and it is located way below the skin. But it is definitely not hygienic to share your towels with anyone at all because you don't want to be sharing their skin microbiome, right?
Right.
And we see a lot of patients who have got fungal infections, superficial fungal infection, sharing towels and contracting it, but not for acne.
So, what's the relationship between makeup and acne? Like somebody with acne, should they be, applying makeup on the skin, or they should avoid it?
So, even in makeup, you have this oil-based makeup, liquid-based makeup, which is very thick and cakey. So, physically, it blocks the pilosebaceous gland and it causes acne. So, acne comedogenic. So, it's better not to use thick makeup in people who have acne. Even the type of sunscreens they use should be hydrogel-based sunscreens, very mild. And then you have people who work in KFC, work in McDonald's, who are frying stuff all the time. Then you have something called oil acne. Because of the fumes of the oil that come out, they have a lot of acne on their face, chest, back. Because of it. Yeah, oil acne.
So when should someone with acne should stop trying products in the drugstore and consult a dermatologist, or go for a treatment?
Yeah. So, unfortunately, in the drugstore, what the patient would get would be a quick fix for acne, right? And very unfortunately, it falls under the category of topical steroids. Because steroid-based creams, what do? They immediately reduce inflammation. But what happens to the patient? They're using the cream, they feel great, and they want to keep using it. And there are patients who use it for a few years together, and they come to us with something called a topical steroid modified face. Right? That is a term by itself because the day they stop using the cream, it's like a drunkard who's been having a quarter every day, suddenly stopping to drink alcohol.
Withdrawal symptoms.
They get very bad acne.
Okay.
It's very difficult to treat. The skin is thinned out, a lot of hair growing on the face. Skin is worst quality of the skin. So drugstore treatment, please don't do it.
So why those products are still in the shelves?
Yeah, they are given to patients who have got skin diseases, dermatitis. So say there's a patient who's got say a bindi dermatitis, right? She's got, wherever she's putting kumkum or she's putting a sticker, she's got an inflammation there. So the dermatologist gives her the treatment of a topical steroid for 2 weeks, saying you put it there and don't use a bindi so that it doesn't come back again. Now this lady also happens to have pimples on the forehead. She starts using the cream and she notices that the pimples are also going away initially to start off with. And then she thinks, okay, this looks like a treatment for pimples itself, and she continues using it herself. So most of the topical steroid modified faces are self-treated, not by the prescription of a dermatologist. So we as dermatologists, we have all gotten together to help spread awareness about this condition, wherein people are using wrong creams like Panderm, Betnovate for years together, which cause a lot of damage on the skin, which is, it gets potentially irreversible after so many years of using it.
So it makes the acne much worse.
Later on, in the long term, but the short term benefits are very real.
Right, okay. What are those steroid-based?
Steroid-based creams.
Okay. Always look for salicylic and
benzoyl peroxide, retinols. These are the creams which actually help. So the whole thing about acne is early treatment, right? So if it's a 1 or 2 acne which can be treated from outside and it's doing well, please stick to the treatment. But if they are leaving deep pits and scars and lot of pus coming out of it, it's out of your hands. So it's better to seek help then. Yeah.
So what do you guys do?
So we give oral antibiotics. It's a bit of a long course. Secondly, after reducing the infection, then we give oral retinols to reduce the size of the oil gland. So combination of these two will give very good results, and the person who's always had acne every day of their life can actually be zero acne free. Yeah.
Nice. And what's the duration of this course?
Around 3 months.
Okay. Yeah. First you guys take care of the
treat
bacteria.
The infection, yes.
And then when bacteria is gone, you guys
treat the oil glands.
Yeah. And they don't leave any scars.
The scars which are already left behind have to be dealt with.
Okay.
But no new acne, so no new scars.
Okay. Yeah. The scar issue, does that mean they were late in treating acne?
Yeah. Yes.
So if you treat acne early, there is no chance for scars?
Yes, we can prevent the scars.
Okay. Yeah. And if they have scar, like I know a friend who has face is full of scar
Yes.
because of pimples.
Yes.
They have no. I don't think they have went to a dermatologist or something. So the scars have remained.
Yeah.
And it's not possible to take them out, is it?
Yes.
Like to make it plain.
We can, but the person has to be very committed to it, because this is like what does a scar mean? A scar means that there has been a damage to the skin. And the skin has formed some fibrous tissue which is pulling the skin down. So that is your pit. There is something which is holding the skin down. So what will a scar treatment entail? It will entail removal of that something which is pulling the skin down, fibrous tissue. So we can do laser treatments. We can do PRPs, injecting under the skin to increase collagen and make the scars shallow. So it's all about appearance. Deeper the scar, less the light reflection, more uneven the skin tone. Shallower the scar, more the light reflection, so more even the skin tone. So we look at reducing the depth of the scar.
By giving PRPs,
Injections, doing lasers.
What does laser do on the scars? It just kills the fiber holding it back, is it?
So very interesting, because lasers have got specific targets, right? Lasers are not they are not for scars per se. So in your dermal area, in this area, there's water. It's rich in water. So when lasers are hit, it's called a non-ablative fractional erbium glass laser. So it goes and heats up that water. The body is tricked into believing there is an injury, and it lays down collagen to bypass that injury.
Wow.
It doesn't damage the top of the skin. It
That's
only heats
amazing.
up, yes.
It's like a microwave, just targeting where there's water.
Under, heating up the skin in few fraxels. It's really nice to watch and to see the good results which patients get.
It's immediate, is it?
Not immediate. It takes a lot of time and effort to get it out. So if there are very deep scars, we do something called subcision. We go under the scar and we try to break that fibrous tissue manually. There's a blood clot which forms there, and that clot lifts it up. So we keep doing that serially once a month till most of them have come up. Then the lasers are started. Even after the lasers are finished, they're topped off with PRPs much later on to make the skin smoother and smoother. So it's a very laborious process.
And how expensive it can be?
The lasers are quite expensive. They can cost anywhere between 10 to 15,000 per session. You need around one session every month for 4 months. Then followed by PRP, which is around 6,000 per session.
Which is again course for 4 months course. Yeah. Okay. So if my face is filled with scars here, treatment of that, to minimize it and to make it more even, it would cost somewhere around 1 lakh.
Yeah. Over a span of a year. So I think it's less about the money, more about the commitment to come. Because after you come, after doing procedures like laser and microneedling, there are some restrictions of going out to the sun. So if people working from home, it's great if you can get it done, because you're not meeting anyone, and over the computer there's only that much that people can see. So it's good to get it done when you're not having any active sun exposure.
Okay, and also dietary controls for that?
100%, but not for procedure, but rather for acne.
Okay.
There's no dietary control for. So any skin procedure, sun is the major don't do.
Okay, there's this term called Accutane.
Isotretinoin.
Yeah.
Isotretinoin.
Right, correct. So what are they? Are they valid treatment options?
Extremely valid, but the patient should be chosen very carefully. It's not given to all patients. These are retinols.
Okay.
Right? They help to reduce the size of the oil glands, but they also have some side effects associated with it. So when a patient comes to us for isotretinoin, depending on the age, depending on their type of skin, we always ask them to do some baseline blood test to make sure that they're good candidates. So suppose their liver function test is not good, or if they have high cholesterol, they're not ideal candidates for isotretinoin. And every 3 months we check that. It is a wonderful drug to reduce acne, but not on self-medication, because they do have some side effects associated with them, and they should be never taken by women who are planning a pregnancy within 6 months of taking isotretinoin. So there should be a washout of 6 months before planning a pregnancy for young girls who are on isotretinoin.
So you can't consult somebody else for this. They have to come to the
Yeah,
dermatologist.
it is better
when
they do because we also know when to taper it, right? There's no necessity to be on a high dose isotretinoin. I'm not a proponent for that because an ideal dose of isotretinoin would be 1 milligram per kg body weight, which is what, like for a 60 kg
80,
individual,
60
it's around 60. You know how dry that makes your face, your lips start cracking, your eyes stop producing oil because it reduces oil production, isn't it? You have dry eyes, dry lips, makes life more miserable. So a low dose for short periods and modulated in such a way that it gives good relief without causing any side effects, that's what we aim at.
So what are acne marks and acne scars? Are they two different things?
Yes.
Acne marks.
Absolutely. Because any scar, any injury can lead to pigmentation where your melanocytes, the ever blessed melanocytes which are rushing to help you, they're the first guys which go rushing to that area. And the minute a little bit of sun falls on the scar, the melanocytes are happy to spread melanin and pigment that area.
Okay.
So that is acne marks, dark marks. Then you have acne scars, which are pits. So they're two different things.
Acne marks are temporary.
Acne marks are not temporary. Sometimes they turn permanent. So we do something called chemical peels to help to reduce the color of the acne pigmentation. They help to reduce and soothe the melanocytes, telling them it's okay. You don't have to produce that much melanin. These are chemicals like mandelic acid. Then you have glycolic acid. These are acids which are done in very low concentrations, which don't harm your skin, but they help to reduce the melanocytes from producing too much melanin. They also help to open up that pilosebaceous unit. So chemical peels, though they are called chemical peels, there's nothing too chemical about it. They're all gel-based peels, and these are the latest treatment options available. So while you're doing your treatment for acne, instead of just waiting for the new acne to stop, simultaneously start treatment for your acne scars so that you're able to appreciate the effects of your treatment much better. So when I give treatment for 3 months, I tell patients to come in once a month and get a chemical peel done to help to reduce the old marks. And then you're giving oral medications to stop the new acne. So in combination, they are feeling so much better because there's no pimple and the old marks are fading away as well.
Okay, there are special situations where they have acne over the chest, back. Acne don't just restrict to face, right? They can also pop up from other part of the body.
Correct, you're right. And most of the time, especially the boys, they're happy to wear t-shirts and cover that area. They're not bothered till they're getting married, when some of them have to be shirtless. So then they come to us with horrific scars and marks a week before their marriage, asking if anything can be done.
Okay.
So I always tell them it has to be done at least few months. Give us 6 months and then we can clear off the acne by chemical peels.
It looks very scary, is it?
It is. It is very scary because this is, these are people who are not being able to come to dermatologists simply because maybe they've been busy studying or, right? But, and it's easy to hide that acne, isn't it? Who sees it other than them? But then on the wedding day, everyone's seeing it.
So how do you treat that extreme acne scars on
Very
the chest?
Very difficult to treat the chest and the back especially. They almost cheetah-like marks all over. There's a very deep peel called a non-melan phenol peel. It's applied as a layer on the back. And then we ask the patient to go home. And then slowly, in a period of 2-3 days, the skin peels off like how Fevicol would peel off on your hand, right? And the skin starts lightening. But that should be done once a month for 4 months. So, you should start off the treatment much earlier, not at the last minute.
So acne is not just medical, right? Psychological, mental condition. So how do you not just medically treat it, but also what do you see with the people coming with acne? How do they, what do they tell themselves?
I'm really very happy that there are a lot of parents who are able to understand the impact of these marks. It might be trivial to parents because they might have had acne growing up. It didn't bother them. But they can see how this is stopping the child from socializing. How if there is a sudden onset, lot of acne all over the face, they might make excuses not to go to school as well because they feel a little inferior when their skin is not is looking that way or draining so much pus and is looking very red, irritated. And they have friends who poke fun asking what happened. They call them names and things like that. So you're right, it does have a lot of a psychological impact as well. So whenever a teenager comes in with acne, I do a one-to-one with the teenager. I don't talk to the parents at all because they will not be able to understand fully what the child is going through. But when they hear the child giving me the feedback, then that becomes much more clear to them. So I do spend some time talking to the child and telling them about the right practices, telling them that this is a phase. It's not going to last forever. It's a phase. And you have young skin. So chance of scarring is much lesser in young skin compared to old mature skin. So tell them good practices of not touching, how often to wash, how to control an impulse of eating a pizza and a burger and an ice cream and drinking milkshake the same day, because there are so many triggers which are happening, so that they have to take responsibility for their food habits if they want to see a continuous decrease in their acne. That's a must. And I think we owe it to the patient to tell them that as well, because when they come to us, they need to know the entire triggering factor so that they themselves can prevent it, right? So that's done. And how they should be very good with the skincare routine. I don't give too many products. I always try to make it as less as possible, because adolescents at that age, they have work, they have their studies, they have their extracurriculars, and they have so much other social pressure and things happening. So they don't have that much time for skincare. So simple wash, acne control, sunscreen in the morning, and a night cream at night. These three things are a must. So the impact on youngsters is always physical. It's the way they look at themselves in the mirror. And for a person going through acne, all they can see is the acne. They don't see the good parts at all. Every time they get up. So it's like a spiral, isn't it, Clinton? So you have acne, you're feeling sad about it, but the chocolate makes you feel good. So you have a bit of chocolate to feel good.
Right.
And that triggers another bout of acne. So they never get out of it. Then they end up becoming overweight. They stop doing physical activity. They don't want to get out of the house. And they have this acne and they pinch it and they get the marks. So it is definitely one of those, mental health issues which have to be dealt with as well. Okay. Skincare routines are not only for models or Instagram influencers. Skincare routines for everyone. Identify the type of skin you have and you use the products which will complement your skin. That's about it. And you don't have to do too many procedures after that, because you are already investing in a baseline procedure. Yeah.
What do you mean? Identify the skin type you have.
Yeah.
And then adopt a skincare routine.
Yeah.
So what are the variations at play, and what is the skincare routine for each of the skin type?
So it's not for each of the skin type. It's a basic skincare routine. So you have a wash. Depending on your, if you have a oily skin, it'll be a salicylic-based wash. If you have a dry skin, it'll be just a non-foaming wash. You have a mild moisturizer, which is not going to block your skin. And you have a sunscreen. That's your morning. Very simple. At night, it's the same wash. It's the same moisturizer, but you'll use an active cream at night depending on what your problem is. If you have acne, you will have benzoyl peroxide and retinol. If you have pigmentation, you'll use what is required for pigmentation. So that's the way. So that is the SOS treatment, as and when need based. But your daily routine of wash, moisturize and sunscreen is non-negotiable. It has to be done.
I never had it.
Yeah, but you're blessed with good skin.
Thanks. I mean, not even sunscreen and this moisturizer, and I see people applying Cetaphil or many other things. Sounds silly to me, but I think skincare, not just for women, I think even men, there's even men, I see a lot of content or propaganda, I don't know, skincare for men.
Yeah.
So what's skincare for men? How is it different from women?
So that is only a marketing gimmick, where the skincare for women, the same thing, costs 1.5 times more than the skincare for men. So there is no skincare for men and women. There is skincare. And then you, with the help of your dermatologist, figure out what works for you. It doesn't have to be gender specific. Right? So that men and women thing is only a marketing gimmick, where the women products are more expensive than the general products.
Right.
Yeah, so very interestingly, we have, there's a minoxidil we spoke about, right? So in the US, minoxidil for women is 1.5 times more expensive than plain minoxidil.
Why
it's
is
the
that?
same minoxidil in a pink bottle.
Okay.
Yeah. It's called it's called something, a pink badge or a pink label, pink tax. Pink tax it's called, yes. That's what it is.
If I come for a checkup on skin type, so what would you see? I have a problem with the deep pigmentation of the eyes and a wrinkle.
Yeah.
I sit late night and I don't have a proper work routine.
Yeah.
So my concern would be around pigmentation. So what would be a good skincare practice for me would look like?
Yeah. So I would probably tell you to definitely wear sunscreen. I think that's one thing that you're not doing.
Okay.
Right? So
Yeah, I
basically...
have to also apply to my forehead as
No,
well.
you don't. You can use a cap. You can make it your signature style whenever you step out. Whenever you step out. Because see, people who have lost their hair early always underestimate how bad the skin on on your scalp gets affected by the sun, because it's falling directly on your scalp. And we see a lot of pigmentation, a lot of moles developing there.
Right. I have a lot of moles now.
Yes. So you should be very careful. Please wear a cap whenever you're stepping out of the sun. It's very difficult to keep putting sunscreen all the time, isn't it? And how much of sunscreen will you put anyway? Just wear, the umpire type of cap with a 360-degree cover. That's the one which works, not your baseball caps.
Oh.
So if you have a 4-inch brim, the shadow of it would fall up to your jawline, which protects your entire face.
So
bigger the brim, the better.
Okay. So let's cover pigmentation.
Yeah.
So I think pigmentation is not just about acne spots, right? Dark circles is also a form of pigmentation.
Under eye dark circles is not exactly pigmentation, multifactorial. Maybe because of laxity of the skin, loss of fat.
Then let's deal with pigmentation. What is pigmentation?
Pigmentation is hypersensitivity of your melanocytes, the guys which are producing melanin, to certain triggers in the environment. 90% of the time it's the sun.
So you mean the body is, skin color is changing because of external influence, because of your sensitive melanocytes?
Not only the skin, we're talking about the face, where it is a very complicated, dynamic process, where you'd see people who have patches on their skin, on their cheeks, on their nose, on the forehead. And with time, it's getting worse. And, the poor person's wondering what they're doing wrong. They're enjoying their walk at 11 o'clock. Doctor told them to walk and get sun, which they are doing without a sunscreen. And the sun is constantly increasing their melanin production, which is causing spots of pigmentation to appear on the face. So that is hyperpigmentation, and that is called melasma. Melasma, extremely difficult to treat, extremely frustrating for both the doctor and the patient, because even after you reach a level where the melasma is mostly gone, there is that one episode where the patient is going to the beach. They've forgotten their sunscreen, and all that went away comes back promptly.
What causes that again?
Sun.
Okay.
Hormones. These two. Mainly to sun and genetics. So if you know your family has got melasma, you have, you've seen your aunts, you've seen your mom, you've seen that she's got melasma. There is a 90% chance that you can get melasma as well. So you should be doing sun protecting measures way early in your early 20s to prevent melasma in your 40s. Yeah.
So it can't be treated?
It can be treated, but once it is established dark pigmentation, light pigmentation we can always treat and get rid of. But dark pigmentation is very difficult to treat with only creams. So that daily thing of your sunscreen and night cream happen. But in between monthly ones, patients should come in for chemical peels and laser treatment. It's called a Q-switched Nd:YAG laser. It's used to reduce the melanin production on the skin.
And what's the course of this treatment? Seems like very complicated.
It just goes on and on. It is very difficult to give patients a timeline, because for everything else, I've told you that we can do it monthly once for 4 months. But this one, melasma, it depends on the depth of the melasma. It's not only in the epidermis, it also starts forming down. The deeper it goes, the more difficult it is to treat.
And how common is this?
Very, very common.
Very common?
Extremely common.
Melasma?
Yes.
Out of 100 women?
100 women in their 40s, around 60 are affected.
Wow.
So it's a very high percentage of women having melasma.
What is the area range it occupies?
So you can have it like light freckles, which are there on the nose and cheek area, like a butterfly distribution.
I think my mom has it.
Okay. See, so that's the thing is that we accept it. It's a part of aging, right? But not many people like it, right? You talk to anyone with melasma and you tell them that you can offer them a solution to get rid of it.
And treatment is difficult, you say, no?
Treatment is difficult but possible.
Okay. And what is the course of this treatment?
Few years.
Few years, not immediate.
Not immediate.
In months.
Yeah.
And cost of this treatment would be?
Every
Depends.
peel will cost you anywhere between 2,300 to 2,500, and every laser treatment will cost you 5K. So generally we tell patients to come in between for peels and lasers. So it's done every alternative months. And it's very promising for patients because they do see a fading off of the melasma. So they will take it till the end.
So sun and hormone is a root cause.
Yes,
Of
yes.
If you know you are genetically prone, then you can prevent it by sunscreen.
By taking using sunscreen in your 20s, way early.
Men don't get it, is it?
Not too much because their skin is much thicker, thick skin like you said. And they're producing a lot of oil which is forming a buffer and preventing too much of sun damage. Melasma forms 90% of all pigmentary problems
What does
on
that
the
mean?
skin.
Okay.
So if you are saying pigmentation as a whole and you're asking me what are the different causes of pigmentation, 90%, a big chunk is for melasma. A smaller percentage is for people who are using hair dye for years together, and each hair dye box commercially available contains something called PPD, paraphenylene diamine, which is there in all L'Oreal, Garnier, whatever. So there are some people who are not very responsive to it, but you will see many people with jet black hair, and the skin also starts getting black with time overall, because every time they have a shower, the water from the hair dye falls onto the face, and those microparticles react with the sun and increases the pigmentation on the skin.
Whoa.
So with years, the face is so much darker than the rest of the body. So that is an external cause, PPD induced melanosis. Then we have diseases of the skin which come as pigmentation. The most common we see is something called LPP, lichen planus pigmentosis, LPP. It's a grayish, bluish, blackish pigmentation of the skin. So patients normally come to us when they've gone to a reunion or they've gone to a family function, and then everyone asks them, what happened to your skin? So they have not noticed it because it has happened gradually over a period of time. And maybe the spouse also is with them, so they are not very observant of the color changes. But then when they meet people who they've met after a long time, they ask them, why are you looking so dark? And here in India, there are no filters. People will ask directly, what happened to you?
Yeah.
And that what happened to you is one of the triggers which get the patient running quickly. Monday, urgent appointment. Sunday, there was a party. And then people are asking, what happened to you? Yeah, so that is LPP, lichen planus pigment, sudden change in color of pigment on the skin.
Again, what causes that?
So that is chemical induced. Again, it could be hair dye, it could be perfume, it could be fragrance.
It seems now face is more sensitive skin than rest of the body,
And
right?
it's like 1/10 the thickness of the rest. The skin on the face is 1/10 the thickness than the skin on the rest of the body.
Whoa.
So it
Why
is so
that?
fragile. So that's the way it's made. So we should be so careful in taking care of it.
Right. Dark circles.
Under the eyes.
Okay.
So there is a common misnomer that many people spend a lot of thousands of rupees on under eye creams.
Right.
They don't work. They don't work unless they have certain ingredients like caffeine or things which help to reduce the blood vessels which are supplying the skin. So dark circles under the eye can be because of multiple reasons. Most common is people who don't sleep well, right? Those who have night shifts. So they have
What causes pigmentation when you overwork or don't sleep on time?
So the blood supply, there are veins which are supplying the skin under there. You have very thin skin. So that bluish pigmentation that you have, darkish, is the veins which are flowing actually. Then you have people who have low iron deficiency. Iron deficiency can also come as tired under eye pigmentation. Genetic causes, which you can't do much about, but you can definitely inject a little bit of plasma under the skin and try to increase the thickness of the skin and reduce dark circles. So you can do procedures, but creams, they don't work.
So you see, creams are scams.
See, the ones with caffeine, to some extent, they have some...
What does caffeine do?
So caffeine is like a vaso.
Dilator.
Yeah. So it sort of... reduces puffiness, it reduces... But it has to be massaged into the skin. Then you have very low concentration retinols. But then retinol so close to the eye it's very dicey because retinols are known to be irritants to the skin. So, I would say identify why you're getting the dark circles and treat it.
If I had come to you, like if I I didn't have a scheduled sleep or I've started getting dark circles because of work-related issues. So how to quickly fix it the next day?
That's not there. That's the only concealer. You use a bit of concealer under your eyes. It doesn't go that early. But I mean, if you can slowly start layering a good skincare routine with hydration, maybe in 6-7 months, it'll be better than what it is now.
There is dark circles, no? A little bit?
I think there's a little bit of wrinkling, which is looking like dark circles.
Okay,
Yeah.
it's not dark circles.
Yeah, so when
what
you
is
stretch the
solution
skin,
for wrinkling?
for wrinkling, you'll have to increase the collagen under the skin. So we inject plasma under the skin.
So what causes wrinkling?
So loss of fat or genetics, thinning of the skin, hydration is less.
Okay. Yeah, pigmentation in like dark underarms, dark inner thighs.
Yes.
Dark knees, elbows. I have seen this like
Yes.
pigmentation,
Yes,
not
yes,
darker
yes,
in
yes,
colors.
yes.
So these are very common concerns in India.
Yeah.
So what causes them?
So we'll break it down, okay? So we have pigmentation behind the neck. We have pigmentation to the sides here. Some men who are a little obese or women who are a little obese on the fatter side. Pigmentation to the corner, in the underarms and in the groin area. Right? These are called acanthosis, thickening of the skin in response to high insulin in the body.
Oh.
So these are individuals who we tell them go and get your sugar checked. 8 out of 10 times it comes high in insulin and we've diagnosed them to be diabetic. That's the skin's way of telling you that this person has got high insulin in the body. So it needs to be treated. So by treating that high insulin, you can get rid of the pigmentation with time. Next, coming to your elbows and knees. These are areas of friction. Like when we are sitting comfortably, we always put our elbows. So the skin starts thickening to protect itself. People love using shorts. In school, you keep falling and the knees are one way of protecting your skin. So that's why the knees get a little darker. That can be treated with creams or depigmenting agents. But that acanthosis, that is neck, inner arms, inner thighs, that needs medical treatment.
So you mean these dark wrinkles in the neck is treatable?
It's treatable, but it's not dark. It is a thickening of the skin which is appearing as dark. It's not dark actually.
Okay.
What it is the skin has become so thick that it looks like there's dirt. People try to rub it and get rid of it. That's not.
So how do you deal with it?
So we treat the high insulin level first. So when insulin stops piling the skin, then we start using chemical peels to thin out the skin. That works. So you have to treat the insulin. You can't just treat the skin. It's not a cosmetic only. It's a medical and cosmetic treatment.
What about intimate area darkening? Like bikini line, inner thighs?
Yeah.
Like there are many other things. People are embarrassed to ask, but it's common concern.
It is common concern in all Indian women. So, I mean, we don't tell anyone to do anything about it if it is a normal pigmentation. So I always ask my patients, okay, show me what is concerning you. If it's the normal frictional pigmentation, I tell them to take it out of their head because all South Indian women do have it. A little bit of pigmentation is there, even men have it, right? So that doesn't become a concern. But if it turns out to be acanthosis, which is an early sign of like PCOS, people who are PCOS, high insulin, they can also have it. That is treatable. That is fixable. But even people with normal, I said South Indian women, most of them have it, right? Even for them, it can be lightened with chemical peels. It can be.
Yeah, besides sunscreen, what else can prevent pigmentation?
The limitations that we dermatologists face is that how many creams can you give a patient, right? So every time they come to you, you can't keep changing the cream. But in all honesty, it is that changing of the cream, if the patient is able to understand and do it themselves, like not use the same night product every night, but rather keep switching between kojic acid, arbutin, retinol, a bit of hydroquinone, triple combination we call it. Everything, if it is done in rotation, it is much better for the skin than the same cream applied every night. So it takes a bit of effort till you are able to hit that target of using the right product at the right, like say Monday, Wednesday, Friday, you're using a vitamin C or an arbutin or kojic based product, and the rest of the days you're using retinol. So that combination works very well because one lightens the skin, one increases the skin cell turnover. So it's all good. It's helping your skin to shed and it's helping the pigment to reduce.
Can you permanently lighten your natural skin tone?
That's a very relevant question, Clinton, because nowadays I was very surprised when one patient told me that they had something called a hangover drip, which contained glutathione, which is a chemical which is injected into the veins to help to reduce the color of the skin all over. I think recently there's been a death of one of the celebrity also related to this large doses of IV glutathione injections. These are antioxidant injections, right? And when given orally, they help to reduce the pigmentation on the skin. But the IV injection, there is, as of now, no scientific papers written or, any guidelines which are there to tell you how much is safe.
Okay.
And people who do IV glutathione, they see that the skin definitely gets a lot lighter. But then how far would you go and how long would you use the injections? It is lighter as long as you're doing the injections. So there are a lot of these drip parlors. I don't know if you've heard of
Seriously?
it. There are a lot of drip parlors where there are people who go and get IV drips done of cocktails of glutathione, vitamin C, N-acetylcysteine.
Into the bloodstream.
Into the bloodstream to help to reduce the pigmentation of the skin. I am not very much in favor of it simply because, like I said, there are no guidelines there which help us to know exactly how much to give, how much the person needs, and how much is too much to prevent, casualties. So oral glutathione, on the other hand, is safe to take, and your body will absorb how much it needs, and it will pass out the rest. So you can take that on an on and off basis. Plus, it's good for the liver, so why not?
So what does that do basically? Like how does it?
It's an
lightens the skin?
antioxidant.
Okay.
Antioxidant. It helps to reduce oxidative stress. It reduces the increased production of melanin by your melanocytes.
How much differences it can create?
So I've seen people who've done IV glutathione. It is quite a significant and stark, it really blows their mind away.
Okay.
They've never thought that they could get so many shades lighter. But even in oral glutathione, patients definitely look brighter, and most of the celebrities do it. That's the reason they look the way they do.
Don't you think reducing melanin in the skin would make the skin more susceptible to sun? You are compromising functionality of the skin to the aesthetic of it.
So it's so difficult to explain that to a person who is more worried about only the tone of the skin, not the health of the skin.
Right. I think that concerns more people.
Yeah.
Tone.
And there are a lot of people who get it done, and there are a lot of places who are offering the service as well. So I would say that it is not a very safe practice, first of all. Even one of those, health drinks for weight loss, isn't it? So these are all gray zones. Nobody has gone into the depths of it to understand what happens. Because again, who's in charge of the treatment? The patient themselves. How much would they know? They would not be aware unless someone guides them.
So do home remedies work, like lemon juice, turmeric, potato, tomato? So
all bhaji bonda ingredients. They're better off being deep fried and eaten, honestly.
Many people apply turmeric, I've seen. And there are also turmeric creams.
Yeah, but that's, I think it's about chromatophore therapy, right? Treatment. So if you talk to people who are painters and interior designers, they will tell you how combination of two colors will give another lighter color. So I think it's just that temporary action of something yellow causing a perceived reduction in the skin.
Right. It's a scam.
These are large molecules. They don't penetrate your skin.
Can drinking more water or eating certain foods fade pigmentation?
Drinking more water is one of the questions that we get asked all the time. So there will be the one child sitting in the center and the parents on either side who will say, Doctor, shouldn't she or he drink more water? Now, I wish I could tell you that oral hydration is directly related to acne, dandruff, whatever. It is not. That's a different pathway altogether. Oral hydration is more for your renal washing away toxins and things like that. Right? It's more about what you apply on the skin directly, which affects the hydration of the skin. Right? That's one thing. But eating fruits which are rich in color, that's a naturally occurring antioxidant. They are great for the skin. So your oranges, all in moderation. Of course, mango season, not too many mangoes because mango is very sweet. It will increase acne. Be careful. So a lot of papayas, dragon fruits, strawberries, berries, they are great for the skin.
Okay, fairness creams. There's a huge market in India.
Yes.
So do they actually work?
So,
have you seen any fairness cream working?
Till now, no one with Fair and Lovely has ended up fair or lovely. So, but that is a constant, we have patients, it was a joke in our MBBS time as interns. So, a major operation happening to the patient, and in their bedside, there will be one Pond's and one Fair and Lovely. So they have to apply it post on the minute they come back from surgery. So it's become so integral.
Right.
The name itself has stuck on, I mean, they've named it very well,
Right.
though deceptively so. Right? So, fairness creams, speaking very scientifically, are creams which reduce the melanin production. That's about it. They do work, but they have to be used cyclically, along with some oral glutathione or oral medication, vitamin C, to help to reduce pigmentation.
The obsession with the fair skin in Indian culture.
Yes.
As a dermatologist, how do you navigate, treating pigmentation when there is too much cultural baggage around skin color?
So whatever color you have inside in the covered areas is the maximum you can lighten it to, right? You can't lighten it to beyond that.
Right.
Isn't it? So that is your original skin color. So the areas which are very tanned, oral medications like glutathione do help. Now, what is concerning for me is parents coming in with young children who may be a little darker skinned, but that's because of the melanocytes that they've inherited from the parent. It's not their own melanocytes. Or the child, unfortunately, has got the genes of the grandfather or grandmother who's slightly darker toned compared to the parents. So it is very unfortunate and very sad, but the child from a very young age will be scrubbed and rubbed with coconut milk and turmeric and aloe vera and all those things we discussed with the hope of lightening the skin. So that is wrong. That is wrong. And I do tell I don't encourage any kind of fairness treatment in children. Rather, I tell the parents not to keep reiterating it again and again in front of the child, because it's extremely damaging psychologically as the child grows up.
Right.
If the sibling is lighter than... so
takes the confidence off.
It completely shatters the child, right? So I always send the child out with my staff to go and look at the machines or whatever, and I counsel the parents. I tell them you shouldn't be doing this, right? Because the child looks at you as the caregiver. And if you as the caregiver are constantly talking about the color of her or his skin, it takes away so much of confidence of the child. So rather than that, you focus on the good qualities of the child, because there's nothing that we can do about changing skin tone. You're born with a particular type of skin. You got to make the best that you can with it. Chocolate colored skin, lovely color skin.
Right.
Will be a 6-month-old baby, happy, smiling, chubby, full of life and vitality, and the parents are worried about the color of the skin. I think that is a mindset change which has to be done, right? It is not fair to want to change the color of a child's skin. We are good?
Yeah, we're pretty good.
Yeah. I think you covered sunscreen. My favorite topic.
Yes. Super. Maybe you are biased since you are a dermatologist.
Yes. Yeah, I am.
Yeah.
Yeah.
So the conversation we had just now, you were, the proponent of sunscreen. I may have a different view from it. Where I see the present generation, including my generation, now overly concerned about sunscreen. So the whole point is like applying sunscreen, we are villainizing the sun. So the things have reached to a point where, people are applying sunscreen even they are sitting indoors. So, and also I like, since sunscreens are sort of cocktails of chemicals, there could also be a carcinogenic probability.
These are all valid.
Right.
Valid thoughts. So we'll get to the chemical part first, right? Because that's a very valid reason. And as dermatologists, we see a lot of skin cancers, right? Now, we are talking about things like basal cell carcinoma, melanomas on the skin, which is seen more in people who have been out in the sun. Farmers, people who, sun worshippers, they love going to the beach and sitting in the sun. So when it comes to the chemical component of the sun, whenever you're going to harsh sunlight, and in my patients who are athletes, we prefer something called zinc sunscreen, zinc-based mineral sunscreens. No chemicals in that, just micronized zinc. But for day-to-day usage, you can have a physical or a chemical sunscreen, a combination of both. Physical sunscreen, of course, look a little white tinted, so many people don't prefer that. They prefer chemical sunscreens.
Okay, physical and chemical.
Yeah.
Okay, these are the variations.
Physical sunscreen means you're physically blocking out the rays of the sun.
That is zinc-based. Mineral-based.
So cricketers with those white, basically was there in diaper rash cream, right? Zinc. Right. Then the chemical sunscreens are those which are like hydrogels. They have some chemical components which are helping to reduce the effect of the sun on the skin. right? So then comes your question about risk versus benefit. So is it better to use sunscreen when you're out in the sun or sacrifice the skin to pigmentation, skin cancer? Skin cancer is not very commonly seen in Indian skin, but we see enough. So,
Seriously?
yeah.
Skin cancer caused by sun rays?
Increased sun rays on the skin, we do see. Yeah. And generally, the Caucasian foreigners are more worried about it. And our Indians who have been abroad for such a long period of time that they are considered to be foreigners. So they have the same fear as foreigners, which they don't need to have.
Okay. So,
Yeah.
do you suggest sunscreen even for morning sunlight, like around till 10 o'clock?
So
10
that is
a.m.?
still considered. So think of it as a rising sun, right? So when the slanting rays of the sun is coming in, you don't need to use too much of sunscreen because those take a long time to reach the earth. But the higher the sun grows, the more vertical the rays of the sun, the more harmful it is to you. So if people have iPhones, they have something called a weather app, and there you have something called a UV index, which points the peak time where the sun is indexing. So that you avoid going out at that time, or put a sunscreen when you're going. Yeah.
So you have
And I understand what you say about that nature. You said about nature and sun.
Yeah, so we
yeah.
feel sun as a villain and we disconnect applying the sunscreen and
I will look at it another
not
way.
the harsh sunlight,
Yeah.
but even for the
Light sun.
Yeah.
So look at it this way. There was a study done where there were people who were wearing sunscreen versus people who didn't go out to the sun at all. They were indoors.
Two people.
One person who goes out to the sun wearing sunscreen,
Okay.
and one person who's just sitting at home not going to the sun at all. So they did a comparative vitamin D analysis. They found that the person who's physically away from the sun is deficient rather than the one who wore sunscreen and went out to the sun. So where would you put sunscreen? You would put it on your face. You're not putting it on your arms and hands. You're getting sun here. You're producing vitamin D. Yeah.
I mean, there are a whole generation now applying it everywhere.
I don't know about that, right? So even as a dermatologist, I would rather tell patients to wear UV protective jackets to cover than put sunscreen everywhere.
Right.
It's even physically very cumbersome to put sunscreen every time you're stepping out.
I mean, if we oversensitize, I mean, we would reach a point where people, consider sunscreen just like how we wear clothes, like, without sunscreen they can't go out or something.
But the same thing happened during COVID, Clinton, when people were indoors for most period of time. And these were people who were traveling all the time and there was nothing happening to them. And then they were indoors for around a year or two. And then when they started traveling again, they started developing sunlight allergies.
Okay.
We call it PMLA. All the areas which are exposed, they were getting sun rashes.
Why is that?
Because they were not exposed to the sun for a long period of time, and then suddenly there is a lot of sun falling on the skin. Skin is not able to tolerate certain rays of sun.
So it's on people to people, how sensitive they are to the sun.
Yeah.
Is there a dermatologic test to check how sensitive your skin to the sunlight?
So I think it goes from person to person. You can make out from the skin of the face. So people who have more melasma are a little bit more sensitive to sunlight than those who don't.
Okay.
Does AC also darken the skin?
Okay, he has a question. Does AC darken your skin?
So that's an indirect question. So AC has circulation of non-humidified air, dry air. So it dries the skin, and dry skin is more prone to sun damage.
Oh, okay.
So it indirectly it does darken the skin.
So apply moisturizer.
Yeah, very well. So quick lukewarm showers, lot of moisturizer on the skin.
Doesn't applying sunscreen would reduce your body's ability to generate vitamin D?
No.
No. Okay. So your body would get some wavelength of light to generate vitamin D.
Yeah, it just protects you from the harmful rays of the sun.
So how sunscreens are designed basically?
They're filters basically,
Okay.
UV filters, which help to reduce the harmful wavelengths of the sunlight to damage the skin.
Okay. It's fine-tuned just to reflect that particular wavelength of sunlight.
It prevents that wavelength from causing the changes that cause pigmentation.
Oh, okay. I thought every other frequency. Okay,
Yeah.
it's nice then.
Yeah.
So that's how they are designed.
Yeah.
Okay. So do you say every brand in the market? There are a lot of brands in the market.
Lot of brands.
So how to sort the signal from noise. I think the signal is 20%, noise is 80%.
Exactly. Go for the brands which are now there are some solid companies, right, who have been in the market for a long time. Big brands. You have your CeraVe, no.
Okay.
No.
Yeah, why Nivea? Why not Nivea?
So they are not very strong dermatologically.
Okay.
These are more of a cosmetic concern, isn't it? So I'm talking about brands like CeraVe, Neutrogena, Cetaphil, Avene, La Roche-Posay. These are international brands and they're global brands, and people are, even dermatologists are happy to suggest them because they have been tested, and whatever they say they have on their component, they do have it because they have rules and regulations in place. Now, I'm not talking about our medicated sunscreen. We have a lot of good medicated sunscreen in the Indian market as well.
What is medicated?
Medicated, like what our brands like Sun Pharma or Dr. Reddy's, all of them have. So these are medicated sunscreens which are governed by bodies which are seeing how much of the sunscreen and how much it's doing its job. But I'm saying in general, off the shelf, what you can buy anywhere in the world would be these MNC brands.
Right. I saw overreaction from you when I said Nivea.
So we have Nivea, you have Garnier, you have the blessed Mama Earth.
Yes.
Then you have
so many herbal, herbal creams,
Lakme. So I think these guys have a lot of standing in the market. One is because of the way they're priced. They're priced very well, very reasonably. They are also easy spreadable. But if you notice the medical sunscreens, the ones that you actually apply, the ones that work, they're not that easy spreadable, and they do leave a bit of
What's
white
the
cast.
difference in chemically, how they are different?
The physical part of the sunscreen. So if you're saying that it is plus and SPF so much, who tests them? There should be a governing body testing them and saying that yes, it is what it says it is, isn't it? So if it is easy to spread and it gets beautifully absorbed, something is wrong there. A lot of Korean brands have also come into the market.
Interesting.
Yeah.
How are they?
So there is a company called Beauty of Joseon, and I have a lot of patients using it. And we dermatologists have also tried, tested it, compared. It's not bad. It's not bad at all.
Is it difficult to get it tested medically? Is it? Why aren't these commercial brands going with the statistical testing on these things?
Because they are, I think the governing body which regulates them, like FSSAI, which we have, right? So there should be a standardized testing protocol which is actually checking that if a sunscreen saying it's 50 SPF, what are the brand, what is the basis on which it is calling 50 SPF? So when it's a medicated product, we know it's 50 SPF because it is being tested and it is passed by our drug companies, and and when you apply the sunscreen, we know because there is a line, there is that light mask,
residue,
residue, zinc oxide. It's not pleasant, but it's necessary.
A friend of mine said she is juggling between different sunscreen, so she is confused which one to use, which one not to. And she consulted a couple of dermatologists or cosmetologists, I don't know, but they were saying one recommended one and not recommended the other. So there's a lot of confusion in this space.
I think everyone has their favorites, right? When it comes to sunscreen and things like that. So things which normally work would be a medicated sunscreen, which a dermatologist suggests, of course, depending on your skin type. Because if you have a very oily skin, I'll probably give you a sunscreen. It doesn't matter the SPF. Rather, it'll all be 50 SPF. Rather, it'll be the formulation. A hydrogel for an oily skin individual, a more moisturizing sunscreen for a dry skin individual.
So what are the things sunscreen can prevent?
It can prevent early signs of aging, majorly. It can prevent skin cancers, right? It can prevent also these cumulative, people with sun allergies do well with sunscreen.
Okay, aging is a big sell then. So even I don't like aging, then I need to consider sunscreen there.
Absolutely.
Yeah, there are, as you said, there are studies showing people who get moderate sun exposure actually live longer than those who avoid it completely.
Yeah, we discussed that about people who absolutely don't go out to the sun. So wearing sunscreen and going out to the sun is not as bad as not going to the sun at all. Yeah.
Correct. Yeah, how do you consider SPF? There's a benchmark. I mean, what is that? A chart, right?
Yeah.
So which one to use, which one not
So for
to?
a daily sunscreen, when you're not having too much, anything beyond 15 SPF 30 plus is also good. So there are some things called tinted sunscreens which people use instead of makeup. So that is usually around 30 SPF plus, which is good enough. A heavy physical sunscreen, maybe when you're going out to the sun, maybe trekking, hiking, 50 SPF. But more importantly than 50 SPF, apply it every 2 hours. See, that's the catch there. No sunscreen is going to be waterproof. No sunscreen is going to last more than 3-4 hours if you're out in the sun. Exactly. It depends on how often you're putting it. If you're going to be out in the sun constantly.
So what does SPF stands for? Like,
Sun protecting factor.
okay. How are they indexed with?
It's indexed with, you mean like what is the ratio?
Yeah, I mean, like, what's the number 50,
There is
100 stand for?
there's a formula. I'll just see that.
Okay. Just a curious question.
Yeah. No, there is a formula for SPF. How is SPF calculated? Ratio of the time it takes for skin to burn when with sunscreen compared without sunscreen. That is SPF. So higher the SPF, longer your skin is protected.
I mean, there is like, when I searched about it, so SPF 30 blocks 97% of UVB, SPF 50 blocks 98%.
Okay.
So now SPF 100,
Yeah.
just 99%. Like when you compare these two differences, just 1% difference in protection. So and there are brands which are aggressively pushing
Of course.
of course. Right,
So doesn't it tell you it's a scam?
Right.
Yeah, exactly. I think anything beyond SPF 15 for a light activity and SPF 50 for a heavy day is more than enough.
Right.
Don't fall for that
Marketing.
higher,
So
higher
what are
is
the
better.
marketing gimmick one should look for, or what you obviously see in the market?
Yeah.
Where in the sunscreen industry
Yeah.
that people should...
That 100 is like, it's really wrong in so many ways, right? Definitely not that.
SPF 100.
Yes.
Yeah. Okay. Then anything other in sunscreen industry that, like, myths or misconception or the society, I mean, the industry is doing it wrong. Some bad players are doing it wrong.
That's a good
people
question.
should be aware of
Yes.
and not fall for those things.
Yes. So there are these, people, influencers who will show you 3-finger rule. First they started off as 2-finger rule and now they've gone to 3-finger rule, where they'll show you how much sunscreen has to be applied. The face is so small and the fingers are so long and they are using 3-fingerfuls of sunscreen to put all over your face. Can you imagine how time consuming and cumbersome, and more importantly, how soon that tube will get over, right? So when we were studying, we were told 1 fingertip unit. So this is called 1 finger, tip of your finger to the first line. This much of a good quality sunscreen for your full face every 2 hours when you're out in the sun. So sunscreens which they probably are talking about are the ones which have got a very small nozzle, thin nozzle. So that if you do 3 lines will probably be equal to a good chunk of
Handful,
a,
I mean, yeah.
That's what it is.
That's one.
Yeah,
Okay.
that's one. And how they say that you keep putting that stick sunscreen everywhere you go. It's there's a
right.
it's almost
Stick
like a deo stick, which the jury's still out there. I mean, we are not big proponents of it. Rather, a good quality sunscreen, put once in the morning, once in the afternoon. If you're not doing too much of sun, is good enough. If you're going to be indoors completely covered, there's no point in using sunscreen.
There are indoor sunscreens as well these days.
I mean, there is sunscreen for every occasion.
Right.
But we are more worried about the medical reasons why we're using sunscreen. Yeah.
So that reapply in every 2 hours is not applicable when you are in the office, right?
Yes.
Just
So when
on
you're
the
traveling
outdoors.
too and when you're coming back, if it is sunny.
Okay, this is a good question. So there are concerns about chemical sunscreen ingredients being absorbed into the bloodstream. Should people worry? I don't know if it's a myth or...
It's a bit far-fetched. Into the bloodstream, no. But a few years ago, there was this concern about it causing something called a frontal alopecia. So some chemicals causing a little bit of hair loss at the hairline. So they have been withdrawn. And this was by good companies like La Roche-Posay and thing, which have gone more towards a physical sunscreen now. So getting into the bloodstream is a bit far-fetched, yeah.
Oxybenzone,
Avobenzene, yes.
actinoxate. Okay.
Yeah, these are like, heavy duty
These
chemicals.
get demonized. So are they actually dangerous?
So in the light amount that is available in chemical sunscreen, most of the sunscreens are a combination of chemical and physical sunscreen. So there's not a very high concentration of it. So looking at it, even monosodium glutamate,
MSG.
that was also demonized. But then that's
Right.
what gives the taste, isn't it? So
Right.
I think it's all about the amount that is used rather than the chemical per se. So that's what. So you have patients who tell you about, like, I put sunscreen on my face and then it feels hot. So what these guys do, avobenzene and all of them, is that they convert the harmful rays of the skin and they dissipate it as heat. So that's the reason why they feel hot. Then some patients also say that when we apply sunscreen, it makes us feel a little darker. I think that's all because of the chemical.
Oh, yeah, that's a big concern.
Yeah.
Like
Yeah.
they're applying sunscreen basically to reduce
Yeah,
pigmentation.
yeah.
And then they end up having more
They
pigmentation.
feel a little darker, but you can use tinted sunscreens. So tinted sunscreen have a little bit of iron and things like that, which help to reduce this perceived
So-
pigmentation.
So each type of sunscreen reacts differently to individuals, is it? Or-
Exactly. So there's no one size fits
Oh,
all.
So you have to discover your own sunscreen.
Exactly.
So how do you prescribe someone
Ah.
to discover their own sunscreen for the skin type?
So
And
generally, in mature skin, I give sunscreens with a bit more moisturizer. In younger skin, they don't like too much of chemical, like that whitish cast. So I give them more of hydrogel based sunscreens. So the formulation is important, but the job will be done in the same way.
Common sunscreen concerns and myths. Does sunscreen cause acne? This is a huge concern for people with oily skin.
It can cause if it is used in a sticky formulation. So people with acne should opt for hydrogel sunscreens.
This is getting more interesting. Like you apply something to prevent something and you
So
get
they've
something
chosen the
else.
wrong
Right.
formulation. So sunscreens nowadays are made in formulations with moisturizers and things like that. So they should avoid overtly putting moisture on the skin.
Sunscreen under makeup. Does that work or
Yeah.
do you need to reapply on top of makeup?
Like how much of makeup? So generally sunscreen is put as a first layer followed by makeup, or let go of the makeup and use a tinted sunscreen. That does the job, isn't it?
Okay, I'm new to makeup. So they apply sunscreen first, then makeup, is
Then
it?
put the makeup on it, or let go of the makeup and use a tinted sunscreen,
Okay.
which does both the jobs.
Tinted is colored.
Colored.
Okay, wow. That's a new innovation in
Yeah,
sunscreen.
yeah.
So can sunscreen expire because people have bottles
Yes.
sitting around for years?
Yes, it can, and it can break open also, in the sense that formulation can split into the liquid form, and so
So it's not recommended to
don't
apply
don't
expired.
use. Nothing expired actually. No creams that are expired, no shampoos that are expired. Definitely no sunscreen that's expired.
Is it just as worse as eating expired food? Like
See,
applying these expired chemicals?
but in medical side, it'll probably reduce the efficacy of the product. Not sure about the side effects that
Okay.
it can cause. Yeah.
Does darker skin need sunscreen? There's a confusion about this in the Indian community. Like they are born with melanocyte and melanin.
Yes.
So
It
they
protects from the
have,
sun,
yeah.
but they do develop melasma. Yeah.
So sunscreen is also needed for dark skin.
Yeah, it's not only about the pigmentation, rather it is about protection from the harmful rays.
What about sunscreen for children? When
I
do
don't
you
recommend
start and are there special considerations?
I don't recommend for children. Young children who are not having very harsh sunlight, I don't. They don't have any risks of pigmentation or
Aging.
and how much of sun would they get? It's a fair amount of sun.
Right. So what is the psychology of applying sunscreen? Like why is it? Like is it aging concern, darkening concern, cancer concern?
All of the above.
All of the above. Okay. And what do you see in patients or clients or general people?
So, people wash their face and they do want something to apply, which is a moisturizer. But then they're concerned about pigmentation. I don't want to have photoaging. Can I do something to prevent it? Yes, you can use sunscreen.
Natural, organic, clean sunscreens. Are these better or just marketing? There are hype words used like natural
all
sunscreen,
sounds,
organic sunscreen,
yes.
clean sunscreen.
But what is it? What is the compound? What does it contain? I'm sure it contains zinc.
Right.
That's as organic as you can get. Not
Right.
more than that.
So for someone with melasma or active pigmentation treatment, how strict they need to be with the sunscreen.
Very religiously and strict, because at night we're using creams to reduce pigment. In the morning we're using sunscreen to prevent more pigmentation.
Okay.
So
So
only
you
then it
mean
works.
a person having melasma not applying sunscreen would worsen their aging?
It would
and
not work.
Okay.
It would not work because you are reducing pigment, but you're not actively doing thing to prevent further pigmentation.
So they have to follow sunscreen
Yes,
religiously.
regimentally.
So do you see these outdoor workers who work in the construction, road construction,
yes.
farmers, delivery
Yes,
people?
yes.
I think they should be applying these things, and they should be concerned about sunscreen.
See,
more
the thing
and,
with not with farmers for sure, because
They sweat.
oddly enough they sweat
right.
and they are hard workers, right? So they have a lot of physical activity and things happening, but they do develop pigmentation, which they are not bothered about. But oddly enough, after many years, they develop sun allergy.
Okay.
Can you imagine a person who's been out in the sun for so many years suddenly coming with them? Something has changed. So they are very intrigued and shocked when we tell them that they have a sun allergy. So explaining to a Sardarji that they have a wheat allergy and explaining to a farmer that they have sun allergy is a very difficult job to do,
Right.
because they've been eating rotis their whole life. These have been in the sun their whole life, and then suddenly
Why suddenly
something has changed, in the body. But that does happen. But we have to identify and do what's necessary there.
who actually needs daily sunscreen, who are on the high priority that they have to religiously have sunscreens?
So people, especially who are traveling to work, traveling in a car doesn't protect you from sunlight. Rather, you are actually in harsh sunlight times, peak traffic areas where there's a lot of sun coming in. So you would see them having more pigmentation on the side that they're driving, maybe on the right side of the face. Right? So they need to use sunscreen before stepping out of the house.
Moderate priority.
Moderate priority with people working from home who are not going to be out in the sun for long. Weekends, if they are stepping out, please put sunscreen and step.
Lower priority.
Definitely people, older aged individuals who are inside the doors. Children who don't have much sun exposure don't require sunscreen.
Okay, product recommendation here and the sunscreen for someone in India. What are good and affordable sunscreen options that actually work? So we'll look at multiple option, affordable, mid-range, premium. Any recommendation, affordable sunscreens? Any
So I
shout
would
out?
say the multinationals which we discussed. So you have Neutrogena. The UltraShear is pretty good. 50 SPF it says, and 50 SPF it has. Cetaphil is great. CeraVe has got a good range. Now, more pricey will be Avene, La Roche-Posay. They're a little bit more expensive. Photoprotect Fusion Water, that's also expensive, but it works great.
These are premium.
Yeah, and it feels great on the skin.
So what's the difference in price range?
I think it is about the formulation. How they have micronized that zinc to spread so beautifully on the skin without leaving that white cast.
Wow.
Yeah.
Interesting.
Yeah, so it is that patency which they have.
And for oily acne people, what sunscreen?
Hydra gels. So we're talking about formulations, medicated sunscreens, right? So which are non-sticky and which spread well on the skin without leaving the white cast.
Okay, this is very interesting. What about homemade or natural sunscreen like coconut oil as SPF, right?
It's not.
Doesn't have any SPF.
It's used for frying, no? I don't know. I think it's used for tanning. People use it and bask in the sun to get tanned.
Coconut oil has SPF of 7. So do-it-yourself sunscreen is not recommended.
No, please don't do it. Unless you're putting maybe diaper ash cream, zinc oxide, very thick, very aesthetically unpleasing, but it's the best sunscreen.
Since I'm the person who have never used any skincare products, bathing soap is the only thing I apply for all these situations. So walk me through some of these products like moisturizer, cleanser. What are the products that exist for skincare, like skin health? So, and let's explore what each one does. What is the mechanism of action? What do they actually do?
We'll start with the face.
Yes.
Right? So, face washes should be quick. No long face washes, no hot face washes. I'm not sure about that trend of ice, dunking your face in ice, which is going around here. But I think it just gives that shock effect on the face, which sort of chills the skin. And soon after washing, seal it in with a hyaluronic acid based serum. So that, think of it like a Velcro. It is a Velcro which holds on the moisturizer to the skin. So wash with a mild, depending on your skin type. We discussed oily with Sally and non-oily with non-foaming. Put a bit of 1 drop of hyaluronic acid on the face, followed by a moisturizer. So that's about it, morning. And you're not stepping out, don't use sunscreen. If you're stepping out, the last thing you'll do is put sunscreen before stepping.
So on top of that, okay.
Night, you're doing the same thing. You're washing a drop of hyaluronic acid and moisturizer. And then depending on what you have, if you have acne, you will use benzoyl peroxide or clindamycin. If you have pigmentation, you will use alpha-arbutin. You will use a bit of retinol. You'll use a bit of hydroquinone. Prescription products, basically, to help with the problem at hand. So why are you doing all this? Right? That's what you wanted to know.
No. It's like why having moisturized skin is good than dry skin?
Yes. No, that's a great question, because that's what many people, like, especially men, have the question. Like, I did well so far. Now you're telling me to put so many things on your face. I'll tell you what it does. So if you go to Rajasthan, you see the desert, how it is parched, and you have those cracks. Right. That's exactly how dry skin looks under the microscope. So what does that crack give? It gives you a room to get infections, to get skin related, like you apply dye or fragrance, you get allergies. So moisturized skin will hold the skin together and prevent all these things. That's it. So it keeps the skin well hydrated. Hydrated skin is very important, because first of all, it gives you a sense of well-being. Your skin is soft and well hydrated. Secondly, it prevents all sorts of chemicals and bacteria from reaching inside. It just stops it at the outside.
That's the basic skincare routine. Cleanser. What is cleanser? That's one who removes dirt before, like face wash.
That's like face wash.
Okay, do those things work? Like, charcoal face wash and active coal, charcoal. Like, what do they mean in face wash?
So
like the advertisement, they show like they are magnet attracting dirt.
Yes. So we do that when we do something called a carbon laser facial. So we apply carbon and we fire it. So that I know works. I'm not very sure about the face wash part of it, because, you need a surfactant to clean your face, right? Activated charcoal is, I think...
Like a surfactant, okay.
No, it's meant to draw out the impurities, but I don't see how it can do that as a wash, right? Because activated charcoal taken orally can do that for toxins inside the body. But face wash, I'm not sure of that.
Don't you find people find building routine difficult? Like, so how to start a routine on skincare? They may do it for 1 to maybe a week max. So then they will fall back.
Correct.
So is there any advice from dermatologists to maintain a routine?
Yes. So first and foremost, keep the products at minimal. Keep only the essentials, right? So it's very tempting to have a toner, and there are many people who tell me that CTM, cleanse, tone, moisturize. So the toning is not very essential for your skin. It gives you a feel-good effect, because it's something which immediately cools the skin when you apply it, like an alcohol-based or something like that. But that's not very essential. What is essential is how much moisture you preserve. So you wash, you line up in a shelf. So you wash, hyaluronic acid, moisturizer, sunscreen, night cream. That's it. So the first half in the morning and the last part at night.
Interesting. So less is more, good philosophy than having 10-step Korean routines.
Yes.
So do you see any common mistakes here in the skincare routine people doing?
There's a lot of rubbing and scrubbing of the face involved. I don't think that's necessary. Just treat the skin very gentle. Then people love to have hot showers. So hot showers feel great. There's no doubt about it. But it's not great for the skin, because think of a vessel which has got oil in it. You put hot water, you remove all the oil.
Oh.
But what are we trying to do? We are trying to preserve the oils. So quick lukewarm showers. And immediately after washing your body, moisturize it.
And there is exfoliation, no?
Yes.
What is exfoliation?
Yeah. So there are some face washes which have got these beads in it, which help to remove the stubborn parts of the skin, which is not. So people wash with that twice a day. That's wrong. So it's good to wash it on the weekend, once a week, just to exfoliate your skin very lightly, not with too much pressure.
What does that do? It takes the dead cells out, is it?
Cells out, which would fall out anyway.
There's a simply unnecessary step they're doing, you mean?
Not every day.
Okay.
Like, it's not necessary. The deep cleaning once in a while, maybe.
Now, why is that even necessary when skin would go on its own? Derma roller. That is also dry cleaning.
So It's a barrel with 182 needles, which are rolled on the skin. The depth of the needle differs from person to person. Sometimes it is 1 millimeter, sometimes it is 0.5, sometimes it's 0.25. We have a large number of patients who buy derma rollers, and they use the derma roller maybe every day or once a week, maybe for the skin, maybe for the scalp to improve scalp hydration. If you look at the needle under the microscope, you will see that each needle is only for one use. The more number of times you use it, the needle bends and you are actually dragging your skin and causing more harm than benefit.
It's like micro needling, no?
It's like micro needling, but it is very dangerous to do it on a face which is not cleaned and removed of microbiomes, because otherwise you're giving free entry of bacteria to get into your skin.
So it's inwardly dangerous than useful.
Yeah. I mean, we see more side effects than good effects.
So why is it done? Exfoliation again.
It is done because some dermatologists had done for them and they realized that derma rollers are available in the market, so they buy it and they do it.
Okay.
But it's not a good practice.
How is it marketed as derma rollers?
For improving hair growth, for reducing scars on the face. But these are all invasive procedures.
Okay, body skin routine. I think we are
Face.
dealing with the face. So is there any body skin care
It's a simple, quick lukewarm showers followed by with a very mild soap, not a soap. See this Mysore Sandal, Chandrika, Medimix, Lifebuoy. These are all villains for dermatologists because they are very harsh. And they strip the skin of moisture. We want mild, gentle, non-foaming soaps, which will help to keep the... And none of us are rolling in the dirt, rolling in the mud to have accumulate that much dirt on our body, isn't it? So very quick lukewarm showers and a light moisturizer to help to seal the moisture. That's it.
So what's in these soaps that are
I think
like
they're very
harsh on the-
surfactant based. The pH is such that they remove all the oil. But people who've been using it for years, they are very reluctant to change because they feel very squeaky clean using it.
Right. Like somebody using that soap has to transition to a softer soap. So what do they have to see in the labels?
Shouldn't foam too much. It should be rich in like something like a simple white Dove soap. So you know that it doesn't foam too much. And many people don't like it because the skin still feels sticky after washing. That's what we need.
Right.
We need that.
It's like a moisturizer. Is
Moisturizing, very mild.
Nails, were another big topic of its own. What practical concern people have in terms of nails?
Most common we see is ingrown toenails in people who are wearing shoes which are very tight or tapered in front. So the nail is not able to grow out. It pokes the skin when it's growing out.
Oh, right.
So it's good
Heard
to
that.
use broad. If you have broad feet, use broader or use open-toed sandals for some time to prevent that. Secondly, nails which are brittle, which means that there might be some biotin deficiency happening. So you have to supplement well. Nails are a good sign of health. Your hair and nails, these are all dead tissue, dead keratin. But they tell you about what's happening inside your body. So if they're difficult to cut, that's good. That means you're producing good keratin.
I have this condition, like there's a skin
Peeling, biotin deficiency.
Biotin deficiency. What
You
does
do
that mean?
biotin supplements you have to take or eat eggs well or something.
Okay. I thought it's a heat issue, body heat issue or something. Why influencer skin is not a benchmark?
Because we actually get to see what are the procedures that are done by them to get the good skin that they have. So it's not only about product application, you also have to do some procedures. So, it looks very appealing to think that your skin can look as glossy and shiny as it is just by applying some of the products which are shown. But it's not as simple as that. There are things that have to be done via lasers or via hydrofacials, via microbotox to get that shiny looks. So it is not as easy as applying a cream.
You have any questions?
I have one that face yoga.
Face yoga.
Please don't do it.
Okay, what is face yoga?
So
First time
face
I'm
yoga
hearing it.
is where they are using their fingers to massage the face with the hope of preventing sagging of the skin. It does not work. It does not work. In fact, it will further potentiate and make the skin sag more because you're stimulating it so much. Face yoga is not for preventing sagging.
It's like
of the
face massage, is it?
So they may do lot of movements on the face and movements which you wouldn't do on a day-to-day basis, right? Overstimulation of the face. So the the non-sagging of the face is related to some structures under the skin which pull the skin up. So that is not something which face yoga can target. It is mainly surgical. That lift can happen only surgically. It cannot happen through face yoga. Well, I do have a lot of face yoga influencers who come and get Botox done. So it's not the face yoga that's working there.
Right.
Yeah. So please avoid overstimulating the skin on the face. Leave it be. Apply the right creams and allow it to heal naturally.
Any other viral trends?
Retinols which are applied, what is shown by the influencers, they show a very generous amount of retinol to be applied all over the face, including the eyes and mouth. Don't do that. It should be a very small quantity, and you should not put it too close to the eyes and mouth because the skin there is very thin. So it should be less, and it should be done infrequently, maybe 3 to 4 times a week, and it should always be sealed with a moisturizer after half an hour.
Anything else? There are a lot of, I guess, things.
So many. Huh? Peel off that nose thing. Huh? Yeah, so on the nose, there are many people who have these black dots, right? So that's called sebaceous filaments. That goes best with laser treatment. The peel off mask will give you a temporary removal, like removing a scab, but they come back.
Okay, I think we're done with this. Thank you so much for your time.
Welcome.
You have given so much dense information.
Welcome.
Yes, thank you.
Thank you.